Thank you. Good morning. Before we begin the public hearing, I will make the following announcement. Due to the continuing threat to public health from COVID-19, City Council committees are currently meeting remotely. We are using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing notices that are published in the Daily News, Inquirer, and Legal Intelligencer prior to the hearings and can also be found on phlcouncil.com. I now note that the hour has come. Mr. McDermott, will you please call the roll to take attendance? Members that are in attendance will please indicate that you are present when your name is called. Also, please say a few brief words when responding so that your image will be displayed on the screen when you speak.
Councilmember Bass.
Good morning. I am present. Thank you very much, Councilman Parker.
Good morning.
Councilmember Brooks.
Good morning. I am present.
Good morning, Councilmember.
Thank you.
Councilmember Dom.
Good morning, Madam Chair, Majority Leader, and colleagues present.
Good morning.
Councilmember Gautier.
Good morning, Madam Chair, colleagues in Philadelphia present.
Good morning.
Councilmember Gilmore Richardson.
Good morning, Madam Chair. Good morning, colleagues. I am present.
Good morning.
Councilmember Green.
Good morning, Madam Chair. Good morning, colleagues. I am present.
Good morning.
Councilmember Gim. Councilmember Johnson. Councilmember Jones.
Good morning, Madam Chair, colleagues. Philadelphia, I'm present.
Good morning.
Councilmember O'Neill. Councilmember O.
Good morning, Madam Chair. Good morning, colleagues. I'm present as well.
Good morning.
Councilmember Quinones Sanchez. Councilmember Squilla.
Good morning, Madam Chair and colleagues. I am present.
Good morning.
Councilmember Thomas. And Councilmember Parker.
Present. Good morning, everyone. I want the record to reflect that Councilmember Sanchez was definitely connected earlier, so she is probably having some technical difficulties.
Madam Chair, I'm present. Thank you.
Thank you, Councilmember Sanchez. A quorum of the committee is present, and this hearing is now called to order. This is the continued public hearing of the Committee of the Whole regarding bill numbers 220284, 220285, 220286, 220287, 220288, 220240, and Resolution 220300. Mr. McDermott, please read the titles of the bills and resolution.
Bill number 220284, an ordinance to adopt a capital program for the 6 fiscal years 2023 to 2028 inclusive. Bill number 220285, an ordinance to adopt a fiscal 2023 capital budget. Bill number 220286, an ordinance adopting the operating budget for fiscal year 2023. Bill number 220287, an ordinance amending section 101001 of the Philadelphia Code entitled Fees of Commissioners of Records to increase certain fees for the recordings of deeds and mortgages and related documents under certain terms and conditions. Bill number 220288, an ordinance amending section 191403 of the Philadelphia Code entitled Imposition of Tax by creating a Philadelphia County Demolition Fund to increase and encourage economic development by demolishing blighted properties within the city, imposing a related fee for recorded documents and related items, and making technical changes, all under certain terms and conditions. Bill number 220240, an ordinance substantially increasing the budget and number of areas and neighborhoods around the city served by the Community Life Improvement Program to improve the health, safety, and cleanliness of every neighborhood and enhance the quality of life for all residents. And resolution number 220300, a resolution providing for the approval by the Council of the City of Philadelphia a revised 5-year financial plan for the City of Philadelphia covering fiscal years 2023 through 2027 and incorporating revised changes with respect to fiscal year 2022, which is to be submitted by the mayor to the Pennsylvania Intergovernmental Cooperation Authority pursuant to the Intergovernmental Cooperation Agreement authorized by an ordinance of this council, approved by the mayor on January 3rd, 1992, by and between the city and the authority.
Thank you. Today we continue the public hearing of the Committee of the Whole to consider the bills read by the clerk that constitute proposed operating and capital spending measures for fiscal year 2023, a capital program, and a forward-looking capital program for fiscal year 2023 through fiscal year 2028. Before we begin to hear testimony from the witnesses we have for today, everyone who has been invited to the meeting to testify should be aware that this public hearing is being recorded. Because the hearing is public, participants and viewers have no reasonable expectation of privacy. By continuing to be in the meeting, you are consenting to being recorded. Additionally, prior to recognizing members for the questions or comments they have for the witnesses, I will note for the record at this time that we will use the chat feature available in Microsoft Teams to allow members to signify that they wish to be recognized. In order to comply with the Sunshine Act, the chat feature must only be used for this purpose. Now, this morning we will hear testimony from DHS and the Office of Homeless Services, and then later on this afternoon we will hear testimony from Behavioral Health and Public Health. So, Mr. McDermott, the first person to testify from the administration is, I believe, Kimberly. Okay, Kimberly Ali.
Yes.
Kimberly, are you connected?
I am connected. Thank you.
Good morning. Just state your name up for the record and proceed with your testimony. And we want everyone testifying today to know that we appreciate as much of a strong summary as you can possibly give so that we can get to the questions for our colleagues. Thank you.
Thank you. So, good morning. I'm Kimberly Ali. Good morning, Madam Chair Parker and City Council members. Again, my name is Kimberly Ali. I am the Commissioner of the City of Philadelphia Department of Human Services. Thank you for the opportunity to provide testimony to support the DHS Fiscal Year 2023 budget. The FY2023 General Fund allocation for DHS programming is $125 million. Of that, $800,000 represent new funding being leveraged to implement $4 million of new anti-violence programming. With me today is Samuel B. Harrison III, Deputy Commissioner for Child Welfare Operations, Gary Williams, Deputy Commissioner for Juvenile Justice Services, and Nadine Parisi, Chief Financial Officer of the Office of Children and Families, as well as other members of my senior leadership team. At Philadelphia DHS, our main priority is to support children, youth, and families. This means we work to help families stay safe, stable, and healthy so that our children are protected from abuse, neglect, and delinquency. Safety, permanency, and well-being are the core of our service delivery. In 2013, DHS began its reform work entitled Improving Outcomes for Children. Our vision is that fewer children become involved in the formal child welfare and juvenile justice systems, and that families receive prevention and diversion services that best fit their needs. The following goals drive our work at DHS: maintain children and youth safely in their own homes and communities, increase timely reunification or other permanency, reduce usage of residential placements, improve child, youth, and family functioning. While there is more work to do, I am pleased to share that we have made great progress towards achieving these goals. We are trending in the right direction. For example, DHS diversion programs are voluntary services offered to families in Philadelphia who have been reported to DHS hotline but may not need a formal safety service. In the first half of fiscal year 2022, DHS diversion providers served 3,094 children. As of the end of December 31st, 2021, 2,088 children and youth were receiving services in their own homes to assist with stabilizing the family and preventing placement. There are 4,025 children in placement, which is down from nearly 6,200 in 2017. We prioritize kinship care when a safety threat cannot be mitigated, making it necessary for a child to be placed outside of their home. This means that a family member, relative, or someone who knows the child or youth is caring for them while we work to reunify the family. More than half of children in placement are in kinship care, which is well above the national benchmark of 32%. We are becoming less dependent on residential and non-family placements. Just 6.9% of dependent youth in placement were placed in residential care. This is well below the state average of 13% and lower than the national average of 9.5%. Each month, we continue to close more cases than what we are accepting for formal child welfare services. As of December 31st, 2021, there were 35% fewer families open than there were on December 31st of 2017. With our proposed investments in services in fiscal year 2023, I am confident that these positive outcomes will continue. We are also improving outcomes for children and youth in the juvenile justice system. We are doing this by supporting and advocating for more community-based alternatives to placement and to prevent further penetration into the juvenile justice system. We have worked in partnership with stakeholders, the courts, advocates, and community-based providers to build a continuum of services to divert youth from placement. Because of this, over the last 4 years, the delinquent residential placement has declined by over 86%. We continue to divert youth from arrest through intensive prevention services called IPS. IPS providers are strategically located in specific parts of the city. DHS opened its 7th provider location in October 2021, increasing capacity to serve 1,300 youth annually across all the sites. This program is particularly unique. Each youth gets an individualized service plan designed to strengthen their sense of self-worth, enhance life skills, and improve relationships at home, at school, and in the community. In December 2021, in collaboration with Councilmember Gilmore Richardson, other members of City Council, and the Philadelphia Police Department, we established 2 community evening resource centers. The centers are located in the south and southwest sections of the city. The purpose of the centers is to connect youth with services and give them a safe place to go at night. Since their opening, we have served over 150 youth. As the weather breaks, we hope to engage more youth and link them to job readiness training, conflict resolution management, and other violence prevention services. With the support of City Council, we have issued an RFP to establish 2 additional sites, one located in the Central Division and the other located in the Northwest Division of the city. We have made significant progress, but there is still much more work to do to ensure children are safe and families are supported. These efforts are underscored by our journey to become an anti-racist department. We aim to reduce the disproportionate number of Black and Latino children and youth in the child welfare and juvenile justice systems, and to address racial inequities that may contribute to disproportionality. We have partnered with KC Family Programs and the City for the Study of Social Policy to develop a robust anti-racist strategy. Action items include supplementing the training offered to mandated reporters, partnering with the Philadelphia Department of Health and other city departments to establish a support line that connects families to resources, and reviewing and rewriting our policies using an anti-racist lens. In summary, our fiscal year 2023 budget reflects the DHS priorities to improve outcomes for children and families through diversion and prevention services, and when needed, quality and safe placement services. We look forward to our continued partnership to serve Philadelphia's children, youth, and families. My team and I are now available to answer your questions. Thank you.
Thank you so very much, Commissioner Ali. The chair wants to note for the record the presence of Councilmember Isaiah Thomas. In addition to that, I wanted my colleagues to note for the record that we have in queue for this first round Councilmember Jones, Gilmore Richardson, Sanchez, Dom, Bass, Gautier, and Brooks. With that being said, Commissioner Ali, let me start by saying I'm going to ask this question of all of the departments coming before us today, and that is about your diversity, equity, and inclusion efforts, and to sort of reinforce to you that it is ultra important within the services that you provide, not only that we do it to the best of our ability, but that the people who are administering the services from a cultural competency perspective look like the people that they are serving. And so with that being said, I want to talk about the FY2023 budget for contracts and leases. It shows a roughly $8 million increase in contracts and leases over last year, and then like an incremental increase after that. Tell us, if you will, how will that money be spent? Will any of that money go toward reducing out-of-home and congregate care placements, increasing in-home services so that children can remain safely in the home? And please touch on, what's close to my heart because I'm a product of it, Commissioner Ali, and that is kinship care, having been raised by my grandparents, and our efforts to reduce residential placement. In that order, if you can.
Thank you for that question. I'm actually going to defer for the fiscal question to my CFO, Nadine Parisi, to talk about the increase in budget, and then I can certainly talk about our efforts in order to support that increase.
Got it. Thank you. Good morning, Nadine.
Good morning, Council Member. My name's Nadine Parisi, and I'm the Chief Financial Officer for the department. The incremental increase that you're referencing, I think what you're talking about is the payments to other funds. So we've been collecting, this is actually something we're pretty excited about. We've been collecting from one of our major funders additional funds for overhead costs. So we're trying to collect for any additional costs that can be that's allocated to the city that isn't directly reimbursed from the state and federal government. So this is something that we actually started in fiscal year 21. And so these are repayments to the general fund for the cost of DHS doing business.
Repayments to the general fund.
Mm-hmm.
When you look at the $8 million increases in contracts and leases over the year, tell us, if you will, how much of that money is going towards reducing out-of-home and congregate care placements?
So for the $8 million increase, that is just for the cost of doing business overall. Our contract increases are really the main increase that we had in FY20 from 22 to 23 has been for it's a combination, actually, the way the budget is structured. There's additional funding that goes in there for PHL pre-K on the OCF side, and then there's additional funding for the Department of Human Services Child Welfare. That's something that we highlighted through the increase that the Commissioner mentioned for anti-violence programming. We're incredibly fortunate with our budget that we're able to leverage general fund dollars. So this city has given us $800,000, in additional funding, and we're able to leverage that to $4 million in programming.
Okay. So when we talk about that overall increase in in-home services so that children can remain in the home, and we talk about reducing residential placements, can a specific dollar amount be attributed to what we're investing in those areas?
So specific dollar amounts, I would say that we're investing in prevention. So that $4 million is more prevention related. So that's where we have bolstered most of our programming on the prevention side to decrease youth from entering placement.
Okay, let me ask you, Commissioner Ali, when we talk about diversity, equity, and inclusion, and the cultural competency of ensuring that those who are providing these services reflect the constituency being served, talk about your department's efforts in that area, if you will.
Yes, certainly. I'm happy to report that the staff at DHS do represent the young people and the families that we serve. And so we are very proud of that. We do believe that we have some areas of improvement, particularly around Latinos. However, when you look at African Americans, given the fact that the number of families who are served by both the child welfare and the juvenile justice services system are African American, we exceed that big benchmark in terms of our staffing complement. In terms of the CUA case managers and supervisors as well, again, very happy to report their diversity and the fact that they represent the clients that we serve. In terms of our additional diversity, equity, and inclusion strategies that we are employing at DHS, as I indicated in my testimony, the young people who are known to the child welfare system, particularly around placement, are disproportionately African American. And so as a result of that, we embarked on a journey with the University of Pennsylvania as well as Casey Family Programs in order to address our entries into the child welfare system and the disparities that exist. And what we found is that most of the families that become known to the child welfare system is a result of a service need. So it's not as a result of physical abuse or sexual abuse. It is a result of what we call neglect. So speaks to a service need, certainly speaks to poverty. And so some of our efforts also include rolling out additional training specifically for mandated reporters so that we can unpack the difference between willful neglect and poverty. And what we also are doing is that we are supporting families more in the community so that we can provide prevention services. As Nadine indicated, those prevention services is for us to get more upstream to connect families before a report comes into the department. Another thing that, yes.
One of the things I'm going to ask you to do, if you would, is forward to the office of the president a summary of those firms that we contract with, because obviously it's not just City of Philadelphia employees, but the firms we are contracting with to provide in-home services and or other services to residents in our great city. So if you would just provide us an overview of what the diversity, equity, and inclusion looks like with those firms. So within the department, of course, but really talking about those firms as well that we contract with, and they have the benefit of doing business with the city. That would be very helpful for us. The second thing I wanted to ask you was about this Family First Prevention Services Act. Provide us with an update on Human Services implementation of the Family First Prevention Services Act and how much yearly federal funding do you expect to receive from the Act, and what services will that funding go to?
Okay, so let me first explain that the Family First Services and Prevention Act would allow DHS to actually utilize more in-home services in order to stabilize families as opposed to placement. This is the first time that federal dollars can be used for in-home services. The caveat, though, is that those in-home services have to be evidence-based programming. So it has to meet that definition in order for the federal government to reimburse us for those particular services. I'll defer to Robin Ciappellini, who will talk more about our implementation efforts around Family First Prevention Services.
Right. So one, if somebody could just answer the question, if you have an answer, how much yearly funding do you expect to get from the Act, and if there are any specific services that you know that you intend on funding?
Yep, so I'll ask Nadine to talk about the funding, but I will tell you about some of the programs that we will fund. So one of the programs is Effective Black Parenting. Given our population, we want to make sure that we support families in their homes. So Effective Black Parenting is certainly an evidence-based program that we will be implementing in Philadelphia. We also will continue to implement all of our prevention services on the front end, which is family empowerment services, and then the family empowerment centers, again, which is also case management services as well. And those are the main programs as well. And then Nadine can talk about what does this look like in terms of funding.
Mm-hmm.
Sure. Thank you, Commissioner. Funding-wise, the programs that were highlighted by Commissioner Ali are currently funded by the state. So they're funded by the state at this point in time, and then we've been given $2 million to implement the new act. So the $2 million is actually to prepare us to collect the proper information and ready our system internally in order to draw down federal funds when we're at that point. So that's what the $2 million is going to be utilized for. So that's more internal planning associated with preparing our case management system to collect additional information to ensure that we can draw down federal funds for these programs when we're ready.
Got it. Thank you so much for your response. I'll come back to you on the second round. Now the chair recognizes Councilmember Jones.
Thank you, Madam Chair. Let me start by saying thank you to Commissioner Ali and her team for, as I mentioned to her when I first met her some almost 10 years ago, that I could not do your job. You meet families and individuals on their worst day and try to coach them up. And so I appreciate what your charge is and how difficult it is. I even forgive you for moving that curfew center from my district to Member Gardier's district because she bullied you. I forgive you. And that's all right. I'm sure in future rounds, the 4th district may get one as well. But what I want to drill down on is something you helped me with. Every Monday morning at 7 a.m., we have a school's roll call. And in that roll call, we deal with children's safety issues, but it has evolved into some of the frustrations that my principals in the 4th district have. And some of those can be the 2 book bag quote I use, that kids come to school with a book bag full of the studies for the day, and then on the other shoulder, the problems from home. And when it comes to that, there was a mixed review of principals who knew about services like you just mentioned in your testimony. And I want to thank you for at least beginning that dialogue with them. And I need it to continue because there is a real thing called the school to prison pipeline. There is a real thing that you see a lot of those young people early based on the 100 shooter review and have an opportunity to intervene in their lives early on so that they don't wind up the defendant please rise in the courtroom. So I want you to do that. That is a comment question. But my second question is, it's my understanding that there are a lot of youth in your system that are there because their parents are deceased, based on an Inquirer article, and that they are eligible for Social Security. How is that working out so that they can receive those resources, stabilize their lives, and not become bad outcomes later on in life?
Thank you for those questions. And so the first question that I will start to talk about is your question as it relates to the school to prison pipeline. And given all of the evidence that talk about the school to prison pipeline, the department has what we call intensive prevention services. As I indicated in my testimony, those services are located in 7 different geographical areas around the city of Philadelphia. The main source of referral for intensive prevention services is the school district. And the reason why, which is called school diversion, the reason why is because we wanted to make sure we had an impact and to stop the further penetration from young people going from school and getting into some trouble that may lead to arrest and divert them from arrest. And so we have been very successful with intensive prevention services. I will defer to Gary Williams, who can talk more about some of the outcomes that we have seen around intensive prevention services in order to stop that school to prison pipeline? Gary.
Good morning, Madam Chair, Councilmember Jones, and City Council. I just want to go on the record. I have a major delay, so if you guys have problems hearing me, let me know. But there's a major delay in my system with the audio and video. But as the Commissioner indicated, we do have the 7 intensive prevention services programs that are throughout the city. The most recent one we actually implemented that in October of 21 in the Southwest area. As the Commissioner indicated, this is the intervention primarily that we use for school diversion programming. With the partnership of Drexel University, their Juvenile Justice Reform Lab, they actually did a pretty extensive study on the first 5 years of operation with the IPS, and the findings were pretty remarkable in terms of outcomes. What they actually found was that there were 90%. Actually, with that particular time period, there's a 90% reduction in arrests. Alongside of that, there were 34% reduction in serious crimes being reported by the schools. So what that means is the arrests declined, but safety of that particular school that participated was not compromised. The other significant thing was that the young people who were actually diverted by way of the school diversion program through IPS, there was a 2-year period where these young people who were diverted, 2 years beyond the intervention, there were no subsequent arrests of those particular young people who actually participated. That's pretty significant. And so much so, we actually opened that particular intervention for young people throughout the city. So it's not just for school diversion, but it's also for young people who could actually self-refer by way of family, community members, etc. We're pretty happy with the outcomes thus far, and we're absolutely excited about the outcome data that Drexel was able to generate for us. Excuse me.
Can you forward that information to Madam Chair to distribute to members that have the same issues in all of our districts? I'm talking about not just that. There are kids in our city that are hustling to feed their little brothers and sisters. There are kids that are homeless that live in cars and get up in the morning, go to the corner store, get a packet of white T-shirts, change them, and that's how they prepare their day. What I want to know is, how do we identify those distressed youth within the school system so that you tag team the services to them? So they may not wind up in court, but they're distressed based on the fact that in my household, we don't have heat. Or in my household, we can't get toiletries, and I'm not going to school without deodorant. I mean, these are real life issues that how do we identify them so that they don't take that leap into criminality, and we can help them. And that's a part of that Social Security money as well.
Yep. And so in terms of that, how we identify, this is why we need the support of schools, we need the support of communities, and we need the support, of council to help us identify those young people, because it is our goal to divert them. We don't want them to be further penetrated. And so our philosophy is, if once a young person is identified, then we will provide services in order to keep that young person in their home and in their community and divert them from formal child welfare as well as formal juvenile justice services. Unfortunately, juvenile justice services and child welfare services is designed as a reactionary system. And we want to change that. We want to become more proactive. And so our goal is to be in the communities, have providers in the communities, have families and community members and stakeholders and advocates know about our services, and so that they can refer young people before they get in trouble, before the lights are turned off, before they don't have any food, because our goal is to support families as opposed to providing formal services to them.
I'm going to end because my time is up, but I want to thank Member Gim and Member Green for coming on at 7 a.m. so that they know I'm not hallucinating. These educators are at their wits' end because they need those services like parenting classes, because some of these kids are out there on their own. Thank you, Madam Chair.
Thank you, Councilmember Jones, for your questions. Chair recognizes Councilmember Gilmore Richardson.
Thank you. Thank you so much, Madam Chair, Madam Majority Leader, and thank you so much to the Department of Human Services, Commissioner Ali, and your entire team for the collaborative work we have been able to do, I think now over the past almost 18 months, if I'm counting it correctly, around the community evening resource centers to provide safe spaces for young people in neighborhoods between the hours of 7 p.m. and 2 a.m. And I simply wanted to start with a thank you because working with you all, not just on the curfew legislation and then moving to provide resources directly in the community that are culturally competent, that partner with organizations that already have a footprint in local communities where we see the most curfew violations has really, really been one of the highlights of this term for me, and I just wanted to start by saying thank you. You talked about the two centers we have in South and Southwest Philadelphia, and Member Jones, my district council member, know that the center located in Councilmember Gaudier's district also includes the 19th Police District. So if we have young people that want to come over, they can come over to that center. But most certainly, I want to talk about the expansion. And so, Commissioner Ali, you talked about the two centers that an RFP just went out for Central Division, which is North Philadelphia, and then the Northwest Division. And so can you talk about the timeline for the two centers that would be in Central Division and the Northwest Division? I understand the RFP is due April 21st, I believe. And so what will be the timeline and the goal for opening those centers?
Thank you for that question, Council Member, and we appreciate your partnership in order to stand up the two existing community evening resource centers and for the expansion. And so just to clarify, we actually changed the timeline. And the reason why we changed the timeline is because we wanted to do a second pre-proposal meeting. And so we have a second pre-proposal meeting that is scheduled for April the 25th at 4 p.m. The application questions are due on April the 26th by 5 p.m. We will then post those answers on e-contracts on April the 29th, but the proposals are now due May 9th as opposed to April the 21st. We will do site visits and presentations between June 6th and June 10th. We anticipate selecting an applicant by July 1st, the contract execution by July 15th, and commencement of work in the end of August.
Okay, and so the goal is to have the additional two centers up and running by August. And so my one question, because Commissioner Ali, you know, we went through this last time, and we'll continue to find this as a challenge and an issue, but I represent the entire city of Philadelphia, all 10 council districts, all neighborhoods in the city. And so one thing I know we'll get, based on a center being in South and Southwest Division, and now the forthcoming centers in Central and in Northwest Division, is all of my constituents up in the Northeast. And I cannot forget my constituents in the Northeast, recognizing the challenges that they are also facing relative to curfew violations and young people needing a safe space. And so what I did want to put on the record is that we want to work with you all, looking at additional potential prevention dollars and or other opportunities to expand this footprint to the Northeast as well. And in that way, we have coverage in basically all the areas of the city, recognizing that each curfew center or community evening resource center has a footprint of several police districts. So I just wanted to put that on the record for my constituents in the Northeast, for them to know that we have not forgotten about you, and that we are working diligently to expand this footprint to your area. Do you have a response to that, Commissioner Ali? Is there an opportunity for us in the budget process?
So we will go back and have some discussions internally, in terms of the additional centers. Remember when I testified last year around the community evening resource centers, our intention was to roll out 6 centers aligned with the 6 divisions. And so the Northeast Division is certainly one of those divisions that will have a community evening resource center, but we can do some further conversations internally as well as with your office to determine whether or not there's adequate funding, in this fiscal year in order to roll out the one in the Northeast. So we're committed to that conversation.
Excellent. Okay, thank you so very, very much. And then I wanted to quickly move forward to out of school time. And we recognize that out of school time services are indeed an additional layer for violence prevention measures here in the city. And I see in your Class 200 funds that you all are receiving an increase of about $7.9 million in Class 200. Is that correct?
I'll defer to Nadine Parisi about that increase specifically for out of school time.
Okay, and if so, if that figure is correct, I just wanted to know how you all are planning to increase the number and the quality of out-of-school time services and programs offered, and how you will continue outreach for the out-of-school time services and programs that we have. And then lastly, I wanted to ask, because we get outreach all the time from organizations who provide their own level of out-of-school time service across the city in a variety of ways. And a lot of them say that they really lack support from the city, and they may not be, specifically an anti-violence, program on paper, but they are an anti-violence program because they're working with young people and helping to keep them in a safe space and give them recreational activities. And so will there be an opportunity to further support other programming in neighborhoods, programs that may need assistance for the work they are already doing?
We'll actually start with the funding question first in terms of Nadine, and then we'll defer to Waleska Maldonado, who is over out of school time.
Thank you for the question. What I would say is we have made an increased investment in OST from FY22 to FY23. We are very lucky. We have various funding streams that we put into that project, but that program is increasing by almost $3 million from 22 to 23. And then the overall number that you referenced is increasing contracts across the entire department, and that includes the OCF share as well as the DHS share. So I just wanted to make sure that I addressed it because I know that you had mentioned the $7 million increase. So part of that is to OST.
Okay, so part of the 7.9 is OST. The other part is technically OCF.
You got it.
Got it. Okay, so I'll follow up. I heard the bell. I have additional questions. I will send them in writing to the department, but I just wanted to again say thank you very, very much for the partnership and collaboration and for getting the centers up and running so quickly. This was one of the most important initiatives that I have worked on this term, and I just wanted to say thank you, and I'm looking forward to the additional centers up and running very, very soon. Thank you, Madam Majority Leader. Thank you, DHS.
Thank you, Councilmember Gilmore Richardson, and thank you for your advocacy in this area. And mentioning the Northeast, I was at the 53rd Ward last night, and that was one of the things they talk about. What about us? So thank you for mentioning that for the record. Chair recognizes Councilmember Sanchez.
Thank you, Madam Chair. Good morning, Commissioner Ali. And I want to start with where Councilman Jones started. This is very, very, very difficult work, and I appreciate your commitment and the dedication of the team. Along the lines around the child removal, and I know that we're moving in the right direction, does the department have a goal of where we should be, since we still are the major city that has child removal and child placement? What is our goal?
In all transparency, council member, it's difficult for us to try to determine what the goal is, but I will tell you where we are. And so back in 2017, as you know, we were removing 7 children out of every 1,000 children. However, as of today, we are removing 4 children out of every 1,000, which is a 46% decline in the rate of removal. So we certainly celebrate that. I think the reason why it's difficult to try to determine what the end goal is because we know that removals are a direct result of our inability to keep a young person safe in his or her home. And so we haven't determined what the right number is, but what I will say is that we are committed to making sure that we only remove young people at the very last resort when we cannot keep them safe in their home. And if we do remove them, then we will place that young person with kinship care. And so we still trying to figure out what does that look like in terms of the right number.
So let me continue to be a strong advocate for us changing our policy around removing the adults as opposed to the children. I still believe that child removal, when a child comes forward and is in an abusive situation, when we remove the child, we further traumatize them as opposed to moving the adult. So in this space, I think that and again, I know that your team is working and we're headed in the right direction, but I think this philosophically, we really need to revisit how we do that. How are the contracts? So, this CUA rollout, was in my district. We're now probably in year 10. Around this, how are contracts reflecting the fact that we're removing less children, so we have less children in the system, and how is the contracts reflect that work, and how do we move that money from, if we're removing less children, and put it on the prevention side? How is that being reflected in the contracts, right?
Yes. And so that's exactly what we're doing. Because we're doing less removals, this is the reason why we were able to do additional investments in some of the prevention programs that I spoke about earlier. So our family empowerment services, our rapid service response initiatives, all of our parenting programs, our Achieving Reunification Center, our intensive prevention services, our Don't Fall Down in the Hood programs. And so we shift that money. So when we don't use that money for placement services and removal, we shift it to so that we can leverage in-home services. In addition, we also was able to increase our concrete good fund. What our concrete good fund is to provide concrete funds for families. So whether that is they need some rental assistance or utility assistance, or they need food because of food insecurity, then we will also use that money so that we can assist families as opposed to removing the children.
Who's making those decisions? Are those at the CUA level, or is that at the DHS level?
That's at the DHS level. And so our contracting is centralized, so the CUAs do not shift their money around prevention services or removals or even salaries. And so those decisions come back to the department. We make those decisions based on data. So, the indication that, our placement numbers are decreasing or our congregate care numbers are decreasing, we look at the system as a whole, and then we make decisions based on that.
So there should be an expectation that the dependency on CUAs and the contracting with CUAs will be reducing over the next few years, and that money we will better be reflected in our prevention budget. Is that the expectation?
That is certainly our goal and expectation.
Okay. Look forward to looking at that. I'm happy to hear around some of the flexibility and resources, as we all know that many times that is what children need in order to stay in the home. So I'm happy that there's more of that being done. As it relates to the KUAs, in the last few months, we've started to get more and more calls. And I want to follow protocol around privacy acts. What is your ombudsman process when there are tensions between KUA decisions and parents, and how is the best way that we can handle that? Sometimes our KUAs get very defensive when we ask questions about case files. I just feel like there should be a better protocol, or a seamless way of, there's a disagreement between a KUA decision and a parent, right? We had a situation where a KUA was insisting that there be virtual meetings when the child was 9 months old, right, during this COVID time, and saw the frustration in a mother who couldn't see a child, right, and that the KUA was insisting that it be done virtually. What processes do you have internally for us to better channel those cases?
Yeah, so we actually have what we call CAIRO, or the Commissioner's Action Report Office. That office reports directly to my office, and that's why it was designed to fill complaints. So not just by complaints in reference to KUA and KUA services, but any provider as well as DHS. And so when we fall short and need to be held accountable, so it goes through our Commissioner Action Response Office. We do have every intention, though, to improve that office. And the reason why we want to improve the office is because we want to make sure that when families call or email the office, that they also have an opportunity to speak to another family member, or with young people, if they call, that they can speak to a youth. And so our intentions for fiscal year 23 is to hire peer advocates, so young people as well as parents, in order to help support our Commissioner Action Response Office and some other areas in the department.
And then finally, as it relates to the prevention side of all of this, right? Can you speak directly and provide, as part of this budget process, where are we increasing slots? How are they reflective of the violence, right, that we see, and some of the police data in these neighborhoods, the correlation between the two?
Yeah, so we can definitely provide that information to your office and Madam Chair.
Okay, but the bell has rung. Thank you so very much, Commissioner, for your work. Just finally, I know that we are still in conversations about the East Division Reporting Center. Do you have any additional updates to report on that?
So what I will report is that the provider is partnering with another organization just to make sure that their staffing, their competency is reflective of the communities that they'll serve. So I will be providing a later update once that's solidified.
Thank you. Thank you, Madam Chair.
Thank you, Councilmember Sanchez. Chair recognizes Councilmember Dom.
Thank you, Madam Chair, and good morning. And again, thank you all for all the past work you've been doing. Today, I'd like to focus on what I believe is the biggest crisis, one of the bigger crises in our city, in addition to the public safety and gun violence, and that is the crisis in Kensington. The crisis in Kensington is a humanitarian crisis, and the drug and violence that is occurring in Kensington is beyond anyone's imagination, and it's the worst in the country. And I know the administration has said for a long time that Kensington is a priority, but it doesn't seem that way to the people who live in these areas on a day-to-day basis. The death and destruction that Kensington residents have to live with seems to go up every year. Nevertheless, between the city, other government agencies, local nonprofits, civic associations, and neighbors, there are lots of efforts underway to try to make life in Kensington better. So while we're talking about those efforts as part of our budget process, I'd really like to know what you feel has been effective in Kensington from your department, and what would you consider that we should be doing in Kensington to make it better? And the third question is that do we have a policy of containment there, or do we have a policy to try to fix the problem and change it going forward? Because I can tell you that no other section of the city would this be allowed.
Thank you for that question, Councilmember Dom. I'm actually going to defer to First Deputy Mayor Jessica Shapiro, who will answer those questions given the work that she is doing with the administration around Kensington.
Good morning, Councilmember John. Good morning, members of council and Madam Chair. I'm Jessica Shapiro, and I'm the first deputy in the Office of Children and Families. As part of the Office of Children and Families, we have the Department of Parks and Recreation and the Free Library of Philadelphia, and we have been, and as long as with DHS, and we have been very much concentrating on being able to provide a safe summer for the children and families in Philadelphia. So we have extensive amount of planning that we are going to be working to establish mobile play parks, open our pools, and we're working with the police department to ensure that those activities are safe for young people. We are also working with the providers in the area to help provide summer jobs for young people, as well as programming at McPherson Square Library. Councilmember Dobb, we have been meeting very regularly with the mayor's office and other health and human services cabinets, the Department of Public Health, Department of Behavioral Health. We have increased our cleaning with CLIP, and we have a contract with a nonprofit called CEO, where they're out in McPherson Square Park and other parks on a daily basis. We're also collaborating between our park rangers as well as the police department to so that police and park rangers are patrolling together. We are in agreement that the situation in Kensington needs to improve, and so we are focusing on providing from our office, providing a safe summer for kids and families in the area.
I guess my concern is, like, Saturday night, I drove by around 10 o'clock at night, and in front of McPherson Square, Saturday night, 2 bonfires, huge fires, 8 to 10 feet up in the air, 30 or 40 people congregating. I probably counted 8 to 12 people from Kensington and Allegheny down to Lehigh that were dipping on that block, with 5 or 6 people with their arms outstretched and open needles in their arms, out in the public view. And I know that Councilmember Sanchez has been screaming about this for years, and I don't feel we're doing enough to support her and Councilman Squilla in this district. And I think we need to do way more than we're doing here, because I just saw the clip that appeared a year ago calling Kensington one of the worst neighborhoods in the United States. I mean, this is unacceptable. So I appreciate everything that's being done. I just think we need a different look here and a different way of solving this humanitarian crisis. It's just, if you want to go with me one night at 10 o'clock at night, I'm sure other people will join us. We can walk from K&A to Kensington and Lehigh. You'll see what I'm talking about. Once you take that walk, you realize how bad this neighborhood is, and it's a disgrace that we're allowing this to continue.
I understand, and I can assure you that we are committed to working with our other government partners in the community to improve it, and investing in our resources to do so. You'll see in the Parks and Rec budget that we've invested some more money into helping cleaning and in the Kensington area. So I'm happy to continue to have a further dialogue with you, Councilmember Dom, and any other folks from council, because we agree things need to improve.
You know, in council last Thursday,
Madam Chair, I have a point of information.
Chair recognizes Councilmember Sanchez.
Jessica, thank you so very much. And I know there's a lot of conversation. I really think it's irresponsible for us to try to program McPherson with 800 people living in the streets. I know that you guys want to appear that you're doing work for children. We have school buildings and other facilities that we could be doing programming, but to send the children in, right, to save the park is not a good strategy. I said it last year. We do not have 40 police officers to babysit, right, the ability for you to do programming at the square until we can reclaim it. So I just want to go on the record that I think it's a bad idea. I thought it was a bad idea last year. I continue to say to you, we have school buildings, we have other facilities. When you make a decision to have 800 people living in the street, you cannot send the children as a way of saving it. So I just want to go on the record on that.
Thank you for your point of. Thank you for your point of information, Councilmember Sanchez. We know how long and deeply involved that you have been with working with the administration and anyone else to address these issues in that region. Jessica, did you want to give a response to Councilmember Sanchez's note for the record?
Yes, thank you, Councilmember Parker. I did want to just add that we are providing programming in schools and in rec centers in that neighborhood as well. And I understand the council members' concern about McPherson Square, and we will certainly factor that in as we make further decisions.
Thank you so much.
Thank you.
Yield back to Councilmember Dom.
Thank you, Madam Chair. I just want to mention that I think the biggest concern I have is our policy. And I'm not sure this is your responsibility at all. It's just that I don't think the policy of containment is the right policy for this neighborhood. That's just not going to work, because what we're doing is destroying a neighborhood, and we've seen that for decades. So I think we need to rethink how we're going to handle this issue. And that's why we called upon this resolution with Council Members Sanchez and Squilla last week. I think we need more resources and we need more help. I also don't feel this is a Philadelphia problem, because more than half the people there are not originally from the city of Philadelphia. They may have Philly IDs now, but they weren't from the city. So I think we really need more resources. We need to listen to the community groups that are there. They have some really great ideas on how to solve these issues, and we need to have a fresh approach, because I don't think what we've done has worked. So I'll yield to the next questions, but I just want to put that on the record. Thank you, Madam Chair.
Thank you, Council Member Dom, for your efforts here. Chair recognizes Council Member Bass.
Good morning, everyone, and thank you, Madam Chair, for this very important meeting this morning, this hearing around DHS. Was a committee that, I feel like it's such an awesome responsibility to serve as the chair for DHS. And so I want to thank Kimberly Ali and, of course, Jessica Shapiro and the entire team, because I know that this is not easy work. And I know that this is a job I often say about city council. This is a job you have to love to be able to do, because if you don't love it, it can really just take you out. I mean, you really have to be all the way in. And so I want to start out with appreciation for the work that you do. My questions probably are going to be critical. But I feel like that's the responsibility of this committee, of this body, is to ask the hard questions just so that we can get to a better place. And so that's the goal here. So I just want to but start out saying that I really do have very much an appreciation for what it is that you all are doing. The first thing I want to ask you about is CUAs. As you know, I've been having a great deal of concern around the CUA system, the community umbrella agencies, which have been put into place really to, I guess, reduce the number of social workers in the city of Philadelphia that are dealing with child placement. And I reviewed the most recent CUA scorecard, as I do every year. And as usual, it leaves a lot to be desired. These are our most vulnerable citizens in the city of Philadelphia. And so the idea that in some areas the CUA agencies are failing really is totally and completely unacceptable, again, with our most vulnerable population. So I'd like to hear you address what it is that we're doing about the CUAs, the scorecard, and how we are going to make the system right. To be honest, and I'm just speaking, from my personal opinion, I don't know that we can make the CUA system ever work. You can't put less money in to a very complicated situation and think you'll get a better product. So I just don't, I'm just being honest. I don't believe that the CUA system, with all of the hardworking people that you have there, the very well intentions of those folks, I just don't see how you are going to get a better outcome with investing less. And if you want the CUA system to really work, then you have to invest more in it, which goes back to what the city's intention was when they brought in a CUA system from the very beginning, which was to save money. How do you save money on vulnerable populations of people who need a lot of how is this ever going to work?
Thanks for that question, Councilmember Bass. And so I will certainly talk about our community umbrella agencies. And I have to start back by just reminding council about where we were. And so prior to improving outcomes for children in 2013, by way of the community umbrella agencies, we were a system that was extremely challenged. And so that's the reason why we wanted to make sure that the roles and responsibilities between DHS and case managers were clarified. And the case managers are provider workers who have been providing services to the department for well over 30 years. And so there is not less of an investment in the system. We are actually investing more with the current system. And I will say that between 2013 and 2017, as the CUAs were up and running and implementing and operationalizing, we were also challenged on that particular time frame as well. And so if I can remind you that in FY17, when we rolled out the initial CUA scorecard, which was our benchmark, we had 7 CUAs who were performing at 2 bells. You know, it's on a 5-bell system. So 2 bells, which was unsatisfactory. Absolutely. So we weren't proud of that at all. However, the CUA scorecard served as a roadmap because we wanted to look at not only compliance measures, but also quality measures. What do we need to do to ensure that young people and their families are receiving the services that they most need and that they are entitled to? And so when you fast forward to our latest report card, which is in FY21, the one we just released last fall, the CUAs are doing tremendously better. And so in FY21, 9 of the 10 CUAs actually achieved 4 or 5 bells. That was the first time that has ever happened in FY21. We did have 1 CUA that achieved 3 bells, but they were 0.2%, just 0.2% less. If they had 2.2%, more than they would have achieved 4 bells. And that speaks to the fact that we are, number one, want to be transparent. We want to measure CUAs accurately. And so that's what you see in the report card. Yes, there are still some growing pains. And what you talk about in terms of where they fall below is around workforce. As you indicated, child welfare is very, very difficult work. And so the CUAs are struggling in terms of workforce. However, we're walking alongside them in order to get them to an optimal level in terms of, workforce. Mm-hmm.
Can I just go through one of the scorecards, 1 or 2 of the scorecards with you really quickly? One in my district, and actually I'm going to go to Turning Points for Children, which is in my district, which received 3 bells, and I get it. We're using the bell system because we don't want to really give grades, because we don't want folks to think about that 3 bells is a C, right? So if you were given this an A, like a traditional alphabet score that you were given in a school setting, this grade would be a C. So we're saying, again, for our most vulnerable children at Turning Points for Children in the Logan and Alany area, which I partially represent, that we're giving them a grade of a C for our most vulnerable children. And they receive a C, and actually they receive less than a C in areas like workforce. The workforce domain includes a measure of staff retention. They receive, less than a C, which will basically be a D or a failing grade, measures of hearing attendance, quality and attendance, and the reasonable effort that goes in. And that went down considerably from one year to the next. That went from an A to a failing grade. So, I'm just looking at these things, and it's this has to be explained. We can't just put this information out without the context to help us explain what's happening with our children, what's happening, with the care that we're providing to these young people who need so much from us and who are really reliant upon us to do right by them. I'm also looking at, I know that Councilwoman Sanchez, as we talk about Kensington, has been just outstanding in her advocacy for her district. And as I look at the report on from APM, which is also a CUA, that the workforce measure has 1 Liberty Bell, which is, again, a failing grade. And then there's others among this group that have 2 or 1 or, really have not adequately been addressed. But I know my time is up, but I don't know if you have any other comments on this. But I just think that the CUA system in itself, and I heard what you said, that we've invested more money, but clearly whatever we're investing is not enough. It's not enough to make sure that we can address the issues in Councilwoman Sanchez's district around the Kensington crisis. It's not enough when you look at areas like Germantown and other parts of my district where we have folks, particularly young people, who have really raised themselves and who are out here on these streets and have access to guns, who have access, who are known to all the wrong people that we don't want them to be known to. And how do we get in front of that? We get in front of it by really doing a better job through DHS and the CUA system, if that's a system that we want to have in place. I'm still not convinced of it, but I don't want to be disrespectful of time, so I'll certainly have more questions on the second round. Thank you, Madam Chair.
Thank you, Councilmember Bass, and I think we will get to a second round, Council Member. So the chair recognizes, before I recognize Councilmember Gaultier, I want to note for the record that Councilmember Brian O'Neill is present. Chair now recognizes Councilmember Gaultier.
Thank you, Madam Chair, and good morning, Commissioner Ali.
Good morning.
I want to start by thanking you and your team for the hard work that you do every day, and thanks also for the work of standing up the Evening Resource Center in my district. It's greatly appreciated. In your testimony, you mentioned that DHS is proposing to spend $4 million in new funds on violence prevention. Can you describe in more detail how these funds will be spent?
Certainly, I can describe in more detail. So the total allocation is $4 million. The general fund allocation is $800,000. And so some of the dollars will be going to, we want to do gun violence case management. And so what we want to do with gun violence case management is add to our intensive prevention services continuum. We want to add staff who focus on gun violence. We also want to increase the gun violence provider, increase their contract. We have one provider who services young people who have already been arrested as a result of gun violence. We want to make that more a prevention, and so we want to increase their contract to also service them. We are putting additional money in restitution. We don't want young people to linger on probation because they have restitution to pay for. And so we allow the young people to work it off through way of community service, and we pay off the restitution. We also are putting some investment with the district attorney's office in restorative justice programming. We're going to add some additional slots to our pre and post evening reporting center for young people who have been arrested and to divert young people from arrest. And then finally is an expansion of our intensive prevention services that we stood up in Southwest Philly. Money is going to that as well.
Thank you so much. Can you talk about how you chose these specific expenditures, how they fit into the roadmap for safer communities, and what your expected outcomes are?
Yes. And so how these interventions were chosen was as a result of the partnership that we have with the Office of Violence Prevention at the city level under the Managing Director's Office. I do have the team members who participate in their tactical meetings with the police department to look at the data. And so we looked at the data, we saw gaps in particular service areas and in services, and so that's why a decision was made in order to fund these additional programs in terms of anti-violence prevention. In terms of the evaluation, so evaluating these particular providers, so FY2023, we will be rolling out an evaluation for the providers. We signed a MOU with the courts, and so we have access to greater data, in terms of young people who are on probation, as well as young people that we service. And so we are looking at data around recidivism, whether or not as a result of particular programs, do the young person have another arrest? Is the young person further penetrating into the Juvenile Justice Services Center? We also want to look at our detention instrument that we use to make a determination as to whether or not young people should be held in detention or release. So we want to look at the fidelity, of that model as well. So those are some of the evaluations that will be rolled out in FY23.
Thank you. And thank you for talking about your participation in the tactical teams. I was actually wanting to ask you a little bit more about that. Can you tell us who from DHS participates in the tactical team meetings, and what are the sort of roles of those staff members at DHS, and how do you typically contribute to those meetings, and what type of follow-up tasks routinely happen following your participation?
So I'll start with the staff, and then I'll defer to one of my deputies who participate. So Deputy Gary D. Williams participates in the tactical meetings. Our director, David Bruce, who's Director of Community Programming, Court and Community Services in the Juvenile Justice Services arena. And then Damon Trent, who is our Administrator over Community-Based Programming in JJS. Gary Williams can talk about their contribution at the tactical meetings. So Gary?
Thanks, Commissioner. Thank you, Council Member Gaudier, for the question. So we're at those meetings consistently. We actually look at information based on police district. One of the tangible things that we were actually able to accomplish, we actually created a database that identifies the DHS supports, prevention and diversionary supports that we have by police district. The other tangible thing, I think actually the Commissioner alluded to this earlier, the implementation of the IPS in Southwest. That was a direct result of actually having information being shared at that collaborative table. And so we're there. I think
Can you just sort of, what does IPS mean?
I'm sorry, Councilmember Gaudier. IPS is the Intensive Prevention Service Program. That again is the primary intervention for school diversion. And so that was the Southwest location was directly linked to the conversations that we had at that collaborative meeting.
Thank you. And then lastly, last year the media broke a very troubling story about DHS using Social Security funds that were designated for youth in our system to repay expenses associated with the care of those youth, even though that is not something that that we are supposed to be doing as a government, sort of charging or expecting payment for services for children in our system. I know that you all are working with Councilmember Gim on some changes to that practice and on stopping that practice. And I just wanted to hear you talk about what's going to be done immediately to rectify that situation, and what that's going to look like and what the timeline will be.
So as you indicated, Councilmember Gaudier, that the Philadelphia DHS, actually all the counties in the state of Pennsylvania, are required by regulation to exhaust all federal benefits before drawing down additional federal or state dollars. And so as it stands, in order to change that, we need to make sure that there is a legal way in order to make that change. We are committed, as you indicated, with working with Councilmember Gim's office in order to make that happen, but we need to do that within the timeframes of the law. And so we don't have no specific timeframes in terms of when we will make that happen. We certainly want to do the notifications, and so that parents or payees know that that's where their Social Security money has been diverted to. However, we are committed in order to changing that practice. But more conversations need to occur internally with our law department as well as with our state partners to make that happen.
I know my time is up, but could you definitively state whether we've stopped that practice? And
we have not,
Madam Chair.
We have not stopped that practice. We have not.
Thank you, Councilmember Gautier. It looks like we might go back to a second round if we can, get there before our deadline. So we can come back around. Rest assured, we will. Chair recognizes Councilmember Brooks.
Thank you so much, Madam Chair. I want to begin by with a thank you for the RFP, for the training for co-workers to support parents with disability. I really appreciate the work that you've done so far, and I was interested to know how is it going, and do you have any update?
So the proposals actually were just due on April the 11th, so 2 days ago, and so we will be selecting a vendor before the end of the month. And then our intention before the end of this fiscal year to roll out training for not only CUA case managers and CUA staff, but also DHS staff. And then for FY2023, we also want to roll out that training for stakeholders. And so the proposals were just submitted on April the 11th.
Thank you so much. And I also kind of want to continue some of the questioning of Councilmember Gautier about the Social Security benefits and foster program. Towards the end, I think you may have answered this, but were the youth or their representative ever informed of this practice? I think you said you're moving forward, but prior to the release of the story, were they ever informed of this?
They are informed by Social Security Administration. However, given the fact that we are the Department of Human Services, we want to also send a letter to not only the rep payee, but also the child advocate. And so we are in the process of making sure that we send notifications. So essentially, the rep payee will be notified by both Social Security as well as the Department of Human Services.
And then my second question, I think Councilmember Gautier was going down there, but her time ended. How can we not only stop this practice, but also get the money back in the hands of these young people who need the support navigating life in general? I know they have done some things in Los Angeles County, like opening savings account with those funds. And do we have, or would DHS, what would you need to do in order to implement something like this?
So if we can't change the legislation that calls for us to stop collecting the Social Security benefits, what we want to do and what we're having internal conversations at the city level about is then who will provide. So is that general fund, an increase in general funds dollars, or is that a split between the state as well as general fund dollars? More than likely, it's probably going to be an increase in general fund dollars in order to ensure that we stop the payments around Social Security. Our intentions is certainly to also establish bank accounts for the young people. We have had conversations with some other jurisdictions who recently stopped their practice and putting systems in place. And so we'll continue to also have conversations with other jurisdictions to learn from some of the things that they have already been doing.
Okay, thank you for that. And finally, how is the STEP program at community schools? How has it been received, and how have they performed?
So I'll defer to Waleska Maldonado, who can talk more about the STEP program and community schools.
Yes, hi. Good morning, everyone. Thank you for having me. So as it relates to the STEP program, one of the pieces that we continue to do is that we have really great communication with the district, but also directly with the principals around not only the case management, but also the behavioral health consultations that we're doing with the families and individual sessions with the students. So at this point, the program continues to be rolled out. One piece that we're working on to figure out is whether or not we could do an expansion, because there have been other schools that have also requested the same type of programming. And they have seen that the programming, by having the behavioral health consultants and the case managers, it has actually increased a lot of the attendance, but also engagement, not only for the families, but also the student.
So are you guys thinking of a plan to potentially expand those services based on the experiences that you had at current schools that have the STEP programs, or just within the community school network?
So for now, we are in conversations with the district to figure out whether or not we can expand outside of the community schools neighborhoods. just to, because we have also identified some schools that are also in need of the program.
Thank you so much.
Thank you.
Thank you, Councilmember Brooks. The chair now recognizes Councilmember Thomas.
Thank you, Madam Chair. I'm going to be very brief. Good morning, everybody. I originally didn't have many questions, but I was been sitting here listening to the testimony, and I agree a lot of the things my colleagues are saying and the concerns that's been communicated. But to add to the list, we're in the middle of a crisis as it relates to public safety, and a lot of the negative activity that we're seeing are involving our young people, teenagers specifically. They're younger and younger as it relates to the culprits as well as the victims. We are, it's 80 degrees outside today. We are right around the corner from the summertime. And I didn't hear not one thing that that relates specifically to prevention-based initiatives for young people between the ages of 14 and 24. Now, the last time we did the budget briefing, I talked to the admin, and I really pushed for positive activities, right? Like intervention-based initiatives are great. I know we're going to spend millions of dollars on intervention-based initiatives, but I think where we're missing the mark is prevention-based initiatives. So I'm wondering, right, what is the plan for DHS to be able to provide positive activities? And I'm not talking about PYN jobs, right? PYN jobs are great from 9 a.m. to about 1 p.m. if you're lucky enough to be chosen and have the right code. So what are we doing this summer to specifically make sure that young people between the ages of 14 to 24 have positive activities that they could participate in the city of Philadelphia, so we can make sure that their time is occupied? And also, what are we doing to ensure that we have free programming for children between the grades of kindergarten and 8th?
Thank you for that question, Councilmember Thomas. And so I'll specifically talk about two programs. I actually talked about one, but we'll talk about another one. Two programs that we will offer, and those programs are offered for young people between the ages of 14. Actually start earlier than 14, but I'm thinking about your time frame, 14 at least until the age of 19. And then I'll defer to my colleague, Jessica Shapiro, who can talk about our summer planning and the offerings around the summer planning. And so as I indicated earlier, intensive prevention services is for young people, positive youth development for young people. Typically during the school time, it is typically offered after school. However, in the summertime, we actually offer it earlier in the day. And so we offer it around 11 a.m. up until about 3 o'clock in the afternoon, as opposed to after school hours. And so those intensive prevention services providers, the 7 locations around the city, are able to continue to serve young people, and they do everything around positive youth development, anger management, but they also have recreation activities for the young people as well. We also have the community evening resource centers, the 2 that are in South and Southwest Philadelphia. They open in the evening to capture young people up to the age of 18. Those hours are from 7 p.m. up until 2 a.m. in the morning. And so we continue to offer those services as well. In terms of the other strategies around what we're doing with recreation centers and libraries, I will defer to Jessica Shapiro. However, note that those Parks and Rec as well as the free library also have budget hearings that are coming up next month. But Jessica, I'm not sure.
No, it's no. We don't have to go to Parks and Recs to the libraries, because I'm already having conversations with them, because I can't understand why we think it's a good idea in the summertime for Parks and Recs and libraries to be open Monday through Friday and not on Saturday and Sunday. So I mean, I could wait to entertain that conversation a little later, but I just want to paraphrase what you just said to me. So you're looking at a prevention-based initiative for young people between the hours of 11 a.m. to 3 p.m. in the summertime. How many young people would that program serve?
So the 7 IPS providers annually serve 1,300 young people. The 7 providers.
I think that with us being in April, we have time to do better and do more. I work with teenagers on a consistent basis, right? And I'll give you an example. They're off school this week. And so I try to provide positive programming for the young people this week, and they don't even want to do anything before 12 noon. Now, that's not necessarily how I raised my children, right? I encourage my young people to be up 9 a.m., 10 a.m., even on your off day. You know, my dad used to say the early bird get the food stamp. I don't know why they didn't get the worm, but that was his thing. But at the end of the day, it taught me to wake up early and on time. So I'm not optimistic about us having a program that runs from 11 a.m. to 3 p.m. to be able to say that that's how we're going to service teenagers in the summertime when we know that we typically see an increase in violence. I also recognize that the community resource centers are open from 7 a.m. to 2 a.m. and I think that's phenomenal. But again, that's not a program, that's a service. That's a place you can go to get service. I'm asking for programming events. Let me give you some examples, right? We have the Roots concert and the Roots picnic coming up. Is there a section there for teenagers that where they can go and have positive events and activities, or do all teenagers have to buy a ticket? Do we have free programming at the zoo? All right. Have we partnered with the zoo? Because I asked the zoo, and they're open to partner with us for whatever we need. We can also look at Made in America. We do a ton of things across the city, right? We can have drive-in movie theaters where young people can go and make sure that they can watch a film and be safe. I just don't think we're being innovative enough as it relates to what we're offering teenagers here in the city of Philadelphia, knowing that we're in the middle of a gun violence crisis and recognizing that, I shouldn't even say gun violence, in a crime crisis, and recognizing that the majority of the culprits, as far as the increased numbers we're seeing, as well as the victims, are young people. So at the end of the day, if we're saying we're really serious about trying our best to address the gun violence crisis that we're facing, how can this be our plan and our preparation? And Commissioner, I'm being honest with you. I think you do a good job, you and your team, right? So I'm not saying that this is 100% a DHS issue, but every department that comes before us, and every time I get the opportunity to push this issue, I'm going to push it because I just feel like we're 100% unprepared. July 15th is going to be here at no time. We're going to look up and we're going to say, oh, man, we have all these children, you know, running around doing things that aren't necessarily positive. What are we going to do with them? Let's figure that out now. So when July 15th comes around, right, we might have to modify our plan, but at least we have a plan. Thank you, Madam Chair. I appreciate the courtesy.
Thank you, Council Member Thomas. Commissioner Ali, anything you wanted to put on the record in response to Council Member Thomas's comments?
I just wanted to say that Councilmember Thomas, all of his points are well taken. We'll take it back to the team. We are continually we meet once a week around summer planning, and so I will take those additional recommendations back. I will say that there's also a briefing at 1 p.m. today that will talk about all of the summer programming offerings that will be offered in the summer as well, but point well taken.
Thank you, Commissioner. To my colleagues, we are now going to go into a second round, but we have to cut it short because folks are also have a number of questions for OHS. So in the second round, we want you to be queued as follows. Council members Bass, Gaultier, and then Quinones Sanchez. Chair recognizes Council Member Bass for the second round.
Sorry about that. Having trouble coming off of mute.
Sure.
Madam Majority Leader, I'm going to try to wrap these questions up in the second round, but I don't know. I guess I'll have to come back on callbacks because I really do have, a lot of questions and need to get down to them. I want to actually piggyback off of my colleague, Councilman Isaiah Thomas, and his comments just a moment ago regarding our summertime activities, because when we look at last summer, and I'm assuming there were, in DHS's opinion, at least a substantial number of, summertime activities and ways to, capture the attention of young people. We still end up with over 500 homicides in the city of Philadelphia. And so as we approach this summer season, there is a very much a feeling of uneasiness, I'll say, among many of us about what is going to be happening, what these streets are going to be looking like, and how we're going to get in front of our young people who are becoming, who have access to guns at an increasingly younger and younger age. I'm talking about 12, 13, 14, 15, which is something that's really newer in the city of Philadelphia, that other than what we've seen in the past. And so I'm just curious as to, how are we going to address this issue? I heard your response to Councilman Isaiah Thomas. I still don't feel like I have an answer as to what we're going to do to prevent bad actions, bad activities. You know, I had a meeting just yesterday with the Department of Parks and Recreation. We have a pool commission for the 8th District to make sure that all of our pools open on time, and the number of issues and hurdles and requirements and, you know, the hopes and dreams that we all have to open up our pools, you know, something that should be very simple and routine in the city of Philadelphia, you know, had all kinds of issues attached to them that we're trying to work through. But just making sure everything gets done is quite a challenge in a organization as big as the city of Philadelphia. So I just don't feel like we really have an answer in terms of what DHS is doing for our kids this summer. So I did want to give you another moment or two to clarify if you wanted to say anything extra on that.
Yeah, and I just wanted to say, Councilmember Bass, so as Councilmember Thomas indicated, it is more than DHS. That can offer programming for young people. And so our system, as designed, is a reactionary system. The Department of Human Services, Child Welfare, and Juvenile Justice Services, which is why we want to move towards a more prevention base. And so that's why I keep talking about intensive prevention services. That's why I talked about the gun violence prevention services, in that the traditional young people who benefited and was programmed around gun violence were young people who was arrested. There are young people who carry guns that are not arrested. And so we want to be able to make sure that we have a prevention arm to that same service that has been helping young people. And so that is one of the investments for FY2023. I would also say that we have done briefings in the past for council around what are the total offerings for the entire city for the summertime. And so we are willing to do that again. Today is a presser at 1 o'clock around what is the total offering. So not only DHS, but as you indicated, Parks and Recs, out of school time, work ready. And so it's more, the police athletically is more of a comprehensive approach to that, as opposed to one specific department. And so we just have to continue to partner, pool our resources together in order to make sure that we are prioritizing young people, particularly over the summertime.
Well, let me just say, I don't want to, in any way, shape, or form, make it seem like it's all DHS's fault. Like that's not at all what I'm trying to say. But I do think that DHS has just a large role on the prevention side, because a lot of these young people may have ended or may have contact with DHS, or they may have contact in other ways with the juvenile justice system. So, I just want to reach out and make sure that those who are particularly vulnerable or, at risk to being a part of some sort of negative behavior, that we're paying attention. Was that 7 minutes already? Can I squeeze it more?
Council member, because we have to go to OHS for this second round, it was only 4 minutes a person because we have to get to OHS and then we have to break.
Okay, my apologies. Can I ask one more quick question? And you can be brief on this, Ms. Ali. And that question is, Philadelphia has been known, we just have been notorious for out of household placements. And I believe we were leading the nation, unfortunately, in this for many, many years. And I know that when you mentioned your priorities, one of them was to reduce the number of out-of-home placements. And can you tell me where we are in that? I know you've answered it a couple of different ways, but I guess my question wasn't answered. I'm trying to figure out, where are we even on a national stage in terms of out-of-child placements in the city of Philadelphia? It's not a distinction that we want to be number one for.
Absolutely, I can't agree with you more. And so let me first state that the last publication around out-of-home placement was in 2017, and at 2017 we were at 7.0 per 1,000 children. We are now at 4% per 1,000 children, so a 46% decline in the number of removals. Unfortunately, because the last publication was in 2017, I cannot compare that with other jurisdictions. And so as soon as we get that data around what other jurisdictions are doing nationally, we will make sure that we provide that data.
Can you give me some sense of where we were compared to, so I know you can't compare, but where would 4% have put us in 2017, the last time the data was released?
4 point, hold on 1 second. 4 point, 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 4
And Commissioner
Just roughly.
Commissioner Ali, we're going to have to ask this to be your final response because we have to get to OHS.
I don't want to give inaccurate data. I cannot find it. And so what I will do is, yes, I will provide that information. So where we are at 4.0 now, what does that look like in terms of other jurisdictions? We will provide that.
Thank you.
Thank you so very much. The final final question in this round is going to come from Councilmember Jones, and then we're going to get to the first round in OHS. So Chair recognizes Councilmember Jones.
Thank you, Madam Chair, and thank you, colleagues, for the great questions. Thank you for answering the one about Social Security as well. I want to segue. We talk a lot about young people, but under your charge, you're responsible for senior citizens too. Post-pandemic, you're not responsible for senior citizens? Do I see you shaking?
No, Councilmember Jones, I'm not responsible for senior citizens. I will say that I'm responsible for if young people are placed with grandparents, certainly, ensuring that the household remains intact, but not, no specific charge around senior citizens.
So issues of elderly abuse, you're not responsible for in a household?
No issues of elderly abuse. We just do abuse of children and youth up to age 18.
Got it. All right. Thank you, Madam Chair.
Thank you, Councilmember Jones. And for any of our colleagues with any follow-up questions, obviously, we can feel free to submit them in writing. Commissioner Ali, to you and your team, any follow-up information that you have in response to our colleagues' questions, you can feel free to provide them to the Office of the President. He will make sure that information is distributed. I also need to note for the record that if we listen clearly to Councilmember Thomas and Councilmember Bass, that briefing that you referenced that will take place at 1 o'clock, just note for the record that city-funded agencies like the zoo, like the MAN, and any other agency, they are going to be expected to offer free programming for our children, and particularly our children who are being serviced by your department. So you should tell them that they should be prepared even when they come before council to answer that question. So thank you, Deputy Gary and your entire team. Hard work, but you do a yeoman's job, and we're proud to have you as our commissioner.
Thank you.
Thank you. Mr. McDermott, can you please call the next witness to testify?
The next witness is Liz Hirsch, Director of Office of Homeless Services.
Okay, I see you, Liz. You are connected. Liz, feel free to state your name for the record. Summarize your testimony because we have several people in queue for questions for you.
Will do. Thank you. Good morning, Madam Chair Parker, and good morning, members of City Council staff and community. I'm Liz Hirsch. I'm Director of the City's Office of Homeless Services. I am joined here today by David Holloman, Chief of Staff, Mary Beth Gonzalez, Deputy for Policy Planning and Performance, Roberta Cancelier, Deputy for Housing Services, Peter Curran, Deputy for Finance, Contracts, and Asset Management, Assistant Chief of Staff Indira I. Potter, and Fiscal Officer Cedric Ginyard. I would like to start by talking about racial equity. Homeless services, particularly rapid and supportive housing, reverse the predictive power of race in connection with one's social, health, and economic success. Housing is the foundation for recovery, health, family stability, employment, and education. People who are Black or African American comprise 43% of the city's population, but 78% of those who experience homelessness. This is a function of historic and systemic racist practices, many of which were promulgated by the federal government. Philadelphia's homeless assistance system does a good job at centering racial equity. For example, exits to permanent housing are higher for people who have been historically marginalized, especially those who are Black, African American, and mixed race, than for the system as a whole. And our workforce represents and reflects the population that we serve. 88% of our workforce are African American or Black. 72% of our leadership are African American or Black. So we continue to promote from within, create opportunities for people of color to assume leadership roles, and to center racial equity both internally and externally, because it is so much integral to ending homelessness. Investments in the homeless service system, especially in long-term housing, are working. Providing the housing resources, investing in housing has reduced unsheltered homelessness and continues to reduce the number of people who experience homelessness. As we say, housed people are not homeless. The number of people who are unsheltered went down from over 1,000 in 2018 to between 700 and 800 this year. When that coincides with the investment in long-term housing. We also know that some of the economic stimulus from the federal government through COVID helped. The number of people experiencing homelessness, both sheltered and unsheltered, has gone down by 24%, and the number of people who are chronically street homeless has gone down by 19%. So while there's still way too many people experiencing homelessness, in fact, nearly 15,000 came to our front door last year, the numbers have gone down. Unfortunately, a large number of Philadelphians continue to turn to the Office of Homeless Services and our provider network of more than 70 nonprofits throughout the city for support and assistance. Last fiscal year 21, we provided homelessness prevention to 1,873 households, 96% successful in preventing a return to the homeless system with a 2-year look back. We provided emergency housing to 8,100 households. 36% exited to permanent housing, 37% increased their income. And we helped 1,500 households enter long-term housing. And I want to highlight 2 programs in particular that were new and innovative that we are very excited about. One was the Street to Home program that helps people who aren't willing to come into shelter move directly from the street into their own unit with support of rental assistance and housing case management for up to 24 months. And that program, Street to Home, had a 94% retention rate after 6 months. And our second, I think, really exciting, new, promising program is shared housing. And this is a partnership with the Housing Authority where we have paid to renovate long vacant scattered site PHA units and house both large families and unrelated adults, not in the same units, but unrelated adults as roommates. 98% retention rate after 3 months and 93% retention after 6 months. And today, housing almost 160 people. This program is so important because it offers permanent affordability, it offers the community of living as roommates, and it especially helps larger families who we really cannot accommodate in shelter given the constraints of our shelter system. I also want to say thank you to all of you assembled here today for including homeless housing in the Neighborhood Preservation Initiative. The first investment that we have made, thank you so much for including us. The first investment will expand that shared housing program, offering another 40 bedrooms, 9 units, 7 for large families. And we're talking families of 6, 7, 8, 10 children, and 2 for shared housing. And I just want to say, if you end up needing to have another place to spend more money, we have more units that we could expand through shared housing. So I will stop there because I know you have a lot of questions. My team is here, or a small subset of our team is here to answer those questions. And we want to thank you again for your support of the work of the Office of Homeless Services and our provider network.
Thank you so very much, Liz, for your testimony. I want to start, Liz, where I started with DHS, with the issue of diversity, equity, and inclusion, and want to just affirm that it's extremely important that the people who are administering the services to our homeless population, that they reflect the people that they are serving. With that being said, I want you to talk about your diversity, equity, and inclusion efforts. And, we were fortunate to be able to have a ballot question, and the people of Philadelphia answered in the affirmative as it related to eliminating the rule of two. I introduced a subsequent resolution here in council calling on the administration to provide an annual report to council about how our elimination of the rule of two is literally helping to diversify the promotional pipeline and just upward mobility, in particular for Black and brown people. And there were some barriers, and I wanted to know, if you could talk about how that effort has impacted your ability, or will in the future impact your ability to diversify OHS.
Yes, thank you very much. Thank you. We're really excited about it. As I mentioned, 88% of our workforce currently is Black or African American, as is 72% of our leadership team, but we love the opportunity to do more promoting within, to creating more opportunities for people, and to breaking down some of the historic barriers that have kept people of color out of leadership positions, specifically when they don't have access to higher education. So we're very appreciative of this opportunity. We're working very closely with the Office of Human Resources, and we do see it as tremendously advantageous.
Listen, thank you so very much for that response. And I also want to say thank you for the update on the street to home and the shared housing program with PHA. It is that kind of innovation that will help us to have a steady increase in the amount of housing that is available for our homeless population, and it will require that kind of innovation, sort of outside thinking, out of the box, in order to make that happen. I want you, if you will, to give us an overview of your department's plans for the $42 million in home art funding that you received under ARP. Tell us how much of the home art money, how much of it will go to developing affordable housing, how much is going to go to non-congregate shelter, and how much to homeless services, and how much to rental assistance. That was 4 buckets: congregate shelter, affordable housing, homeless services, and rental assistance. And I'm going to jot down those numbers you get.
Okay, well, I'll save you from jotting down the numbers. I will send you a fact sheet about it that has it all detailed. But at this point, I'm going to pass it over to Beth Gonzalez, who has been the architect of our draft plan, to give you that summary.
Thank you, Liz. Good morning or good afternoon, everybody. I'm Beth Gonzalez, Deputy Director of Policy Planning and Performance Management. And we are now currently in the public comment phase for the home art. We did consulting in the beginning and sent out a survey to the community, which was 863 results that we received back. And the primary categories of how we can use the money, most of the folks wanted us to work on development. So that's hopefully going to be when we get the final public comment finished in the end of April. We'll see what the additional comments will be for that. But primarily, folks wanted to focus on acquisition, renovation, tenant-based rental assistance, and then supportive services, so in that priority area. So what we're going to do is get all of the public comments back from everyone, get what their additional comments are, and then we'll have our final draft and allocation of how we want to use those funds. But primarily, will be around acquisition and development for that primary activity.
Tell us, if you will, how many individuals do we have currently waiting for rapid rehousing? How many do we have waiting for long-term housing? And will those home art funding, will that be able to significantly cut into those numbers? Do you have those numbers available for us today, Liz? How many individuals waiting for Rapid?
So what I can tell you is that we did a gaps analysis in order to prepare the home ARP plan, and that estimate was that we needed another 474 family units, another 2,800 individual units, and another 163 youth units, taking us to the total gap of being 3,478 units. We anticipate that if the plan were to move forward as proposed, and we do expect that we'll get robust public comment, that it would meet about 10% of that need.
Just 10%. Okay. I want to get these two on the record, and if you could provide responses to each of these questions, that would be great. First, outline for us plans for the additional $12 million that you're seeking for FY23 Class 200 budget. That's first. That's the $12 million additional. And then the final question for me is regarding the HUD funds. I remember reading that article. Philadelphia receives $36.3 million grant for homeless housing and services. With that $36.3 million grant that you recently received from HUD, outline for us, if you will, what programs and funding that is going to, and specifically tell me how does it impact that long-term permanent housing bucket for us, so that people can draw a conclusion. With they see those dollars, they want to know how specifically it's going to impact that.
Yeah, good question. A good question. Question we ask ourselves also. So that $36 million is, with the exception of about 25 units, all renewals. So those are people who are currently housed in supportive housing programs, and that will pay their rent for another year. So the bottom line is it's going to have almost no impact on that gap of 3,400 units that I just outlined. What it will do is make sure that the people who are stably housed aren't displaced. And we have about a 10% turnover, like any kind of rental market, annually. On the additional funds that we are getting, I do believe that they are outlined in the 5-year plan, but I'm going to turn it over to Peter Curran to walk through what those different dollars are, and then Dave Holloman to kind of explain how we got to where we are.
Just a FYI for the public, she's referencing the additional $12 million OHS is seeking for their FY23 Class 200 budget. Thank you.
Good afternoon, everyone. I am Peter Curran. I am the Deputy for Finance, Contracts, and Asset Management. The $12.6 million that you are referencing consists of $5.5 million that was awarded to OHS in, I believe, fiscal year 19 and 20 in response to the Resilient Project. So that's a mix of low barrier permanent supportive housing units and some daytime programs, and also some shelters. There is also an additional $3.2 million, which will allow us to continue 4 non-congregate shelter sites that serve mostly the elderly population. These were stood up by the funding that came from the CARES Act. There is $1.3 million in there in which we will use to fund raises within our shelter system for frontline workers. And there is one more thing that it's $2.3 million for increased security in the Kensington area, and also some to support some of our food programs.
Okay, listen, thank you for that response on the record. Liz, I want to say to you that when you gave us the stats about your leadership team and just the overall department as it relates to diversity, equity, and inclusion. 88% Black and 72% of your leadership team being African American and/or people of color. That is something that others should aspire to. So you all do a great job in that area. Now the chair wants to recognize Councilmember Gaultier. Councilmember Gaultier.
Thank you, Madam Chair. And good afternoon, Liz. And thank you so much to you and your team for everything that you all do on a daily basis to end homelessness in our city and to keep our residents housed. We really appreciate you.
Thank you.
I'm happy to hear that this year's budget includes raises to employees in the shelter system, many of whom are women of color. Can you tell us the median wage for these employees before and after the wage increase?
Councilmember Gauthier, we will have to get back to you with that specific information. What I can tell you is that it's based on our estimate. There's 110 employees who are making $14.25 an hour. These are primarily residential aides, and so this increase will take them to $15 an hour.
Thank you so much. Prevention and diversion services are 96% successful at preventing homelessness, as you stated in your testimony. Yet we're essentially flat funding this program, even with the increased appropriation for this year for prevention and diversion earmarked for raises, increased security, funding for a drop-in center, and eviction prevention. Why, in addition to some of the expenses that we'll be covering, why aren't we investing even more money in prevention and diversion if those are such successful initiatives for us?
Yeah, well, so three things. One is, first of all, we would love to invest more in homelessness prevention. It's tremendously successful and very gratifying. The second, I guess, by way of explanation, let me say that the increase that you're seeing is largely related to inflation in many of our costs, and also it's really making the office whole from cuts to our general fund 2 years ago and this year. So the Office of Homeless Services and the city was very fortunate to get funds through the CARES Act, through the Emergency Shelter Grant Program at $35 million. That money is sunsetting. And so we really carried the city in part in the budget by using that money to cover what had been city funded services for the past 2 years. So a lot of what you're seeing is just gap filler, plus some of those inflationary costs like security, and then obviously investing in our workforce, which is long overdue. And the only real expansion that you're seeing in our budget is for our 4 non-congregate sites, 3 SROs, and 1 non-congregate shelter. And this really came out of a lesson that we learned from the pandemic around the graying of the homeless population and a way to keep older adults safe. And so these programs have been tremendously effective in helping older adults. We're talking about 65, 75, 85, as old as 92 years old, come in. We wrap our arms around them, give them food, clothing, shelter, care, and then 250 people have moved into long-term housing. So we're really excited not to have to close those programs. But above and beyond that, we're really looking kind of at a maintenance budget, and that means that anything that we add, we have to take it away from somewhere else. Our homelessness prevention programs are largely funded by state and federal resources. The HOME program, CSBG, Community Services Block Grant, a little bit of Emergency Solutions Grant, and the city's Housing Trust Fund pitches in about $750,000. But if there's a penny to squeeze out of it, we will definitely put it into homelessness prevention.
Great. Can you clarify for council how much every dollar invested in prevention and diversion saves OHS?
You know what? I have to relook at those numbers. I don't know off the top of my head, Jamie. I have not looked at that in a minute. Let me get back to you. I believe that the estimate, unless somebody else on the team has it at the tip of their fingers, I believe that that we estimate that 10 to 20% of the people who are prevented, for whom we offer prevention, would have come into shelter.
Okay, so a big impact.
It's a big impact, yeah. Well, and it saves. I mean, how do you cost out the human impact, right?
Yeah.
I mean, our prevention efforts focus on families, and so anything we can do, particularly young families where the parent has experienced homelessness or been in the child welfare system themselves, because they are most at risk for homelessness. So anything we can do to keep them safe and to keep them stable and not enter shelter or have the trauma of experiencing homelessness, all the better.
Thank you. The pandemic exacerbated already grave needs for quality services for people on our streets, including shelters and housing that is wheelchair accessible, plans for times like COVID when shelter beds are, maybe insufficient to meet demand, and housing with services that breaks the cycle of street homelessness. What new programs, services, and capital investments does OHS intend to make to address these issues?
Well, I think there are going to be some things that we can do and some things, frankly, that we can't do. There are some holes in the system, in our system at large. For example, for people who are unsheltered, who have incontinence issues and have physical disabilities, they're probably some of our most challenging people, because providing care for someone who needs assistance with activities of daily living does have to, that's a licensed function. So we are working together with the health department and with DBH-IDS and some of our providers to look at how to fill that gap. But to be honest with you, we don't have an easy answer. I can tell you that 20% of our 20 of our shelters are wheelchair accessible, and that as development is taking place, that we are prioritizing accessibility to try and meet those needs. And we've also created the PEACE program, which has helped nearly 100 people who had been in congregate sites who do need assistance with activities of daily living get into a less restrictive, more secure, and more dignified setting. So that's also been, I think, tremendous progress.
Thank you. And I'd like to come back on the second round, Madam Chair.
Thank you, Council Member. And listen, just for the benefit of the members, I've been advised that we are not bound by the 12:30 break, just that we had to complete OHS. So we will get to a second round, Council Member Gautier. Chair recognizes Council President Darrell Clark. Council President, are you connected?
Thank you, Madam Chair. Yes, I am. How are you? Sorry, I was reading a text on my phone. I need to pay better attention. I just had a couple of brief questions and actually one question with some subsets of additional questions about that issue. And first, I want to say, Ms. Hirsch and your team, I want to thank you all for the work you do over the last couple of years, the significant level of challenges that you have had dealing with one of the populations that in the best of times is always difficult to provide resources and to be in a position to deal with that population. So I want to commend you and thank you so much. Just had a quick question with respect to some emergency housing vouchers that we got basically through the Housing Authority. And the information that I've gotten is the Housing Authority received an allocation of approximately 863 housing emergency housing choice vouchers that were available for using starting in July 2021 under the proviso that PHA must accept referrals from OHS And it's been a while. We're getting close to a year. So I got a couple of questions regarding that and the status. How many persons or households have been referred to the Housing Authority to date? And I must tell you, I have answers to these questions, but I just want to confirm them.
So it's a test, huh? Yeah, I think we are at over 50% have been referred. The numbers I have are as of 3/31. So we have 292 vouchers have been issued and 76 have been leased so far.
All right, so actually the number is 494, 57%. And my question with respect to that number, how many referrals of individuals have actually gone to families?
34%.
34%. And 66 individuals. Is there a reason why there's a disparity in those two numbers, families versus individuals? Have we prioritized individuals or?
We prioritize people who are literally homeless, and then there is a screen that we to try and ensure that that it creates opportunities for people who have been historically marginalized. And so that screen, that's what the results of that matching process are. We're continuing to get more referrals of families, largely through the domestic violence network. But that's basically, actually, that represents more families than are in our homeless system. But our system tends to be more individuals than families. I don't know. Let me just see if Beth wants to add anything.
I want you to use up all my time with your answer.
Oh, sorry.
I asked you a specific question. So it sounds like it doesn't matter. And I'm asking this because this is a housing voucher. That's a little different than, putting a person in a shelter bed, whole 9 yards. Housing vouchers are some of the most sought after type of assistance. And my question is, why wouldn't we utilize that for family placement more so than individuals? Because our families are, being able to put a family with a voucher allows you to get a multi-bedroom unit versus a traditional shelter bed space or some other type of short-term.
Yeah, well, we share your concern about families, particularly families with little children, because you want to interrupt that generational poverty and homelessness. The emergency housing voucher is just one housing resource. So we also have a supply.
Liz, all due respect, I'm asking you very specific questions about this particular program. I don't want to divert into other programs. Why are we only using half of the amount of housing vouchers versus individuals with this emergency housing voucher, and not prioritize families for this, given the nature of what we traditionally use with housing vouchers? Is there a reason?
So we have prioritized people who are literally homeless. That is our top priority.
You said that.
Yes, and we've prioritized people who have been recently housed as a move-on strategy to get flow through our system and more opportunities. And we've prioritized victim survivors of domestic violence for this. And let me just defer to Beth here for a moment, who I think may be able to provide some additional clarity.
Please.
Thanks, Liz. So when the community voted on what they were prioritizing, there was no prioritization of singles over families. So it is true most of the people in our system are individuals. That's why right now it seems to be the majority, over 60% again, with the individuals. But again, most of the vouchers that are going to families are coming through the domestic violence referrals, because that tends to be mostly the reason why those that are coming to shelter needing assistance are experiencing domestic violence. So we are watching it and monitoring to see who's needing it, and as folks come in and we complete the assessment.
All right.
Yeah, and I'll piggyback. And I apologize. Good morning, good afternoon, everybody. Council. I'm sorry I had eye surgery a year ago. I'm still recovering. And so part of that, we absolutely agree that using these housing vouchers will interrupt the trajectory of how family outcome is. And so we're continuing to evaluate. One of the things that we have been seeing in our shelters are families that are with multiple kids, 3 or 4 kids. And so as we look at the rental markets, we're going to continue to evaluate, and we will love the partnership with any of you, how we get that out there. It is a very limited resource and a one-time resource, so we want to maximize these vouchers to the best of our ability. So we welcome any feedback and how we can best utilize these vouchers while giving the demands of the need of housing opportunities.
The other thing I would add to with these vouchers, services don't come with it. So if families need services, this wouldn't be the ideal resource for them. So when we look at other vouchers and what services families need, we want to make sure we set them up for success with the best housing type for them as well.
Okay, so that's a decision. I'm kind of getting mixed signals that it's a decision to go that direction, to focus primarily on homeless first. Then the secondary, tertiary issue is related to the type of family we're trying to please, or the type of individual or the client. How many vouchers have been issued as it relates to the 494 that was referred?
As of the end of March, 292 vouchers have been issued. So there's probably more as of last Friday. We get a weekly report from PHA.
All right, so you can update me, but as of the March, the last thing we have, a little over half of what we've actually given, and we've issued 292. How many of those 292 are actually living in units, leased units?
76.
I'm sorry.
I'm sorry.
How many people actually living in?
Well, I don't have the number of people, but 76 units as of the end of March, the report I'm looking at, had been leased.
Okay, so was there a reason why we're at such a low number? And I reference other municipalities, and according to the HUD Housing Voucher Dashboard, that shows that we're at a utilization rate of only 10%, with other comparable cities are at like 40 plus percent. Is there a reason why we're so low?
There are a number of reasons why. I think first and foremost is we don't have control over the rental market. It's a very, very tight rental market. It's taking people 3-4 months, sometimes longer, to find a unit that will accept them. We did a landlord survey and got over 400 responses. And many of the landlords who responded, nearly 2/3, said that they would not rent to somebody who had a voucher or who had experienced homelessness. So that means that we have to overcome bias. We have to spend a lot of time and effort building relationships with landlords and convincing them to rent to our people. There are incentives now for landlords, which is extremely helpful. People get signing bonuses. And then we have come together and created a landlord working group within the city. And so we now have an online service called Padmission. And so if you know landlords who would like to rent to our folks and help that number get higher, please send us an email at landlords@philly.gov and put in the subject line Padmission. We now have over 100 units listed on Padmission, and that really does take away a step for people in finding units by finding a place that's already identified. The other thing I will say is that we were told by HUD that we should have a very robust community engagement process. And remember, this was the very beginning of the Biden-Harris administration. And they asked us to get community input, and they asked us to center racial equity. And many other communities didn't do that. They took people. There are easier and harder ways to fill units or issue vouchers. But our community was very involved. It was a several-month process, and they were very clear that they wanted these vouchers to help reverse historic marginalization and historic inequities. And so that meant that we have dedicated to them to people who have had significant barriers in some cases. So we're really proud of the process that we've gone through. We're really proud of the fact that we've had more than a half of those vouchers, those opportunities filled in just 6 months. We really started in October, not July, when the original thing, because we did do that robust community process. And we're really proud of the results that we're getting for families, for young adults between 18 and 24, for people of color. So we're very happy with the way the program is going, and we think it really does accommodate all of the different advocacy voices. We're a very high need city, so it takes time.
Ms. Hurst, you give like really long answers, and I respect that, but I don't want to get cut off. And I know I'm the council president, but on this call I'm just a member of council, so I do have limitations. So let me be clear. You're saying the fact that we are at 10% based on HUD and all other municipalities comparable. I mean, Baltimore, I mean, you don't get much more comparable than that in terms of, they call this our little sister in Miami. I'm sure that there are like significant housing market crunches in those particular cities, particularly Miami. I mean, you're telling me that plus you're trying to, I still didn't quite understand your equitable approach to trying to get people in housing, because I think that the overwhelming majority of these individuals that we're trying to place in housing, people of color, you're telling me that the gap of literally 30% or more is based on the tight housing market in the city of Philadelphia. That's why we're at 10%. And you're saying that you're proud of that number. What I just heard you say.
Right. So we are proud of the program. We're very proud of the work we've done. It's 10% leased up. So we're over half of the vouchers having been issued, and people are looking for units. So it does take time. It is a pipeline. We're working very hard on it. PHA is working very hard on it, and we think that we're getting we're doing well.
What is PHA doing to work hard on?
They put the landlord incentives on the table, and they also funded housing locators.
Okay, so I mean, all due respect, I mean, I'm not happy with 10%, given what I see out here on the streets every day of the week, the number of people that are in need of housing, and it doesn't sound like me that there's anything that you all can do differently, or that you're proposing to do differently, other than asking us to market housing vouchers. I mean, is there going to be a fix or an acknowledgement that the number is too low? Or is it just a response that you've been giving me that there's nothing else you can do?
Well, I guess I'm sorry that the numbers are disappointing to you. Our perspective in working.
This 10% should be disappointing to you. I mean, why is 10% okay? You sound like that's okay.
No, we're not. We're definitely not happy with 10%. We want that to be 100%, to be honest with you. And so we can definitely go back and look at our process to see if there's any barriers that we may have overlooked to increase that to another 90%. We wish that we didn't have to deal with family instability with housing. So allow us to have an opportunity to go back and reevaluate our systems to see if there's anything that can be done there, and to continue to collaborate with other departments, with PHA, to see if we can do more of a blitz to get that number up, so that all of us can be kind of be proud of these resources that have been dedicated to us.
I think the other thing I would add, we have the landlord collaborative, and we're really wanting to make sure that we educate our landlords. Within our survey, over 51% of the landlords were small landlords that had 4 or less units, and about 20% had 30 or plus units. So it's really educating them on what the voucher is, how they can help. We're actually also going to be focusing on BIPOC landlords as well, to make sure that we support them and make sure that they can get into the market as well, because we have to have the units on the back end to leverage the voucher. So it's really, the work that we really need to do is really engaging the landlords and getting them to be open to accepting the voucher. That's really the primary way for this to be successful.
All right. So what I'm going to do, and I'm sorry, Madam Chair, for taking too much time, but I got to blame that on Ms. Hirsch to a degree because she gives me these really long answers, so I'm taking up all the time. We have, I know I speak for myself. I know I have a relationship with the various landlord organizations that are in the city of Philadelphia for various reasons, and I'm going to actually reach out to them to see if there's something I can do. I'm sure a lot of my colleagues, if not all, are interested in ensuring that we have opportunity, along with the Housing Authority, because I'm not sure how many you're referring to the Housing Authority, and there are other entities that they're working with, because I know we're doing a lot of units in the city of Philadelphia. Because 10% is just like, all honesty, is just like beyond unacceptable. We should not be trying to justify it based on any other reason that's out of our control. We just have to do better. So I'm just asking that we acknowledge that that number is not acceptable, is that we approach it in an aggressive way to fix it, and not get into the philosophical issues that, while may be accurate, but frankly speaking, is keeping somebody from getting a place to live. And as the young folks say, you need to do that another time. Right now, we need to get people in housing. It is a real challenge out here on the streets of Philadelphia based on what I see in my council district. Madam Chair, I apologize. So I'm going to conclude my questions. Thank you so much for your indulgence, and thank you all.
Thank you. We hear you.
Thank you, Council President, for your comments there. Always room to improve. Chair recognizes Council Member Quinones Sanchez.
Thank you, and I want to thank Council President. I think everyone in this team knows how hard we've all been working around these issues, but I also kind of want to add my voice to that. This once in a lifetime 863 vouchers are hugely important and can be transformative to families. And what I'm not hearing is, and you know, I've been on the record as saying these vouchers should go to families. You can take care of 5 or 6 people. We have other product lines for individuals and single folks that we can be supportive. But what I am frustrated in the explanation to Council President Clark is, like, there aren't people that need it. We have many families on the PHA list. We have many families that are almost homeless. And why is it that we cannot connect those to this historic kind of designation that could really transform a family?
The priority is for people who are literally homeless. So there are people who are referred to the supportive housing clearinghouse from our homeless shelters, from our domestic violence providers, from our network of 70-some nonprofits who are working with people experiencing homelessness.
Liz, you know very well that we've had this conversation as it relates to the Latino community not going to shelter. And so how is it that you are going to ensure that a community that historically has been underserved, because culturally we will not go into shelters, are going to get access to these, again, vouchers?
So a little between 9 and 10% of the vouchers are going to have gone so far to people who are, or have actually been leased to people who are Hispanic or Latino, Latinx. And we do have other resources at the front door for people so that they don't have to come into shelter, that we've really designed to meet the unique needs of the Hispanic community. We invested about...
Liz, 10%. We're 15% of the population, 30% of the population in poverty. That is not good enough. So I just want to go on the record. You know, you insist on keeping transitional housing, which is expensive and inefficient, and not investing on the front end around the prevention piece. How much of the 42 million, as much as I appreciate all the community output components, 163 people surveying should not have a bigger policy decision-making authority than our housing action plan. How much of that money is going to go to rental assistance, which is a crisis in the city that we have got an historic amount of money from last year. And then now we're in a situation where we're going to have to figure out how do we continue to provide it. How much of that money is going to go to rental assistance?
So I can speak to that. So in our plan that we put in, we, after getting the assessment, and actually it was a survey of 863 responses, we want to use 12% of that 42 million, which is a little bit over 5 million, towards tenant-based rental assistance. And in addition to that, services, which will be about another 5 million as well. And then 55% of that, which is about 23 million, will go towards acquisition and development of affordable housing.
So $10 million to rental assistance, like services.
Yes.
Is that what you're saying? Okay.
Mm-hmm.
So then,
that's proposed.
Okay, that's what it's proposed. Again, we're policymakers. I appreciate community input. We have a housing action plan. We have gaps in services as it relates to housing. The Office of Housing cannot operate as a silo to that reality that we have in the city. And what I hear today appears like you guys are operating in a silo about what's in your department versus what's the needs in the city. And so when the Office of Housing comes up, we will be asking, because where is the connection, the intersection between the work we're doing over there with the Housing Trust Fund, these vouchers, and some of this once-in-a-lifetime funding that's coming in. Lastly, I want to get to the question around Kensington. We are entering summer 5. Year 5, we still have 800 people contained in Kensington who are homeless in the street. Tell me what we're going to do different. And I will start by giving you context. I did a roll call of all my civic organizations and all of the organizations working in the area. And they are all fearful that this will be the worst summer. I can't even imagine a worse summer than 4 that we've had. Tell me what we're going to be doing differently, because I know you believe that what you're doing is working. What are we going to do differently, and what are the people of Kensington going to see this summer?
Dave, do you want to?
Yeah, can you hear me?
Yes.
Yes, I can.
Hey, thanks for that question, Councilwoman, and others who are very concerned about Kensington. We are too. Let me just first say that. It breaks our heart to see that folks are down there that are in the conditions that they are, especially the families that have to deal with that. So one of the things that we're looking at doing, it's not the end all be all, but we're looking at indicators right now. And what we're doing is a 100-day challenge. It is a rapid result pilot that will look at a specific goal. And that goal is looking at how do we place 350 unique individuals into housing or treatment. And let me just reframe that to housing, a pathways to stabilization of housing, because we know from historical perspective, not everyone down there may need a housing opportunity. They may need family reunification that we have done in the past. This will allow us to get at a few things that the community has addressed in the past. Who are those folks that are down there? Are there individuals that are coming from outside of the county that we should be working with those other single county administrators? So this idea of around a 100-day will help us to start to break down system barriers to get a detailed list of, again, of that small subset of number. We know historically when the weather changed, the individuals who come to that area, depending on what the narcotics is of the day, we will see an influx. I always like to, inform individuals when we hear of different numbers and count, there's 2 different things there. There are individuals who are counted almost like a census count, and then there's actually people who are living on the street that we have history and data on. We're willing to continue to work with the number of organizations, you, Councilman Dom Squilla, who has been on the front line advocates for those individuals down there. Again, this is not an end-all be-all. I think we have to have a holistic approach that takes a multitude of different dynamics. I think for people who are dealing with substance abuse, there's a different avenue. There's people who are dealing with mental health, trauma. I think there's different avenues there. It's the same way that we dealt with the large bridges encampment. One of the things that we were able to learn from that was that many of those folks that were living in that area, they didn't want to be there. I don't think anyone wants to be on the street, but how do you connect, engage, and properly assign them to the right resources?
Thank you. I will, and when Jill Bowman comes on from CBH, I do not believe that we are prepared to handle some of the fentanyl, obviously some of this horse tranquilizer that has become a major problem. But I am hearing nothing that tells me that this summer is not going to be worse than the 4 that we have had. And I appreciate the efforts. David, we constantly, this is about working for the folks entrapped there. But we do not have a comprehensive plan for Kensington, and this will be year 5, and shame on us. Thank you, Madam Chair.
Thank you, Councilmember Sanchez. Councilmember Sanchez, if you will, when they reference folks who are there who, come from other counties, particularly in our 5-county area, and they talked about reunification. Councilwoman, talk to us, because that's a struggle that I've heard you mention before. Why aren't we connecting more? Can you just talk a little bit about that?
Yeah, I think it's real important. I think the department has started to work on that, and when CBH comes on board, but it's too little, and it's not scaling up at the level that we need. The majority of the folks, of the 800 people in Kensington, 200 may be actually homeless and Philadelphians. The 600 are folks in addiction who come not only from the 5-county area, but come from New Jersey and have nice suburban homes, right? They are there because of their addiction. And with how we prioritize those folks over the folks in Kensington, we provide millions of dollars in intervention for those folks when we should be sending them to their county homes, right? And reunification with families means we need a dashboard of who's in the street. We have outreach teams. We don't have a dashboard. We don't know who's touching who. And who is really leading that reunification process, which is, we have John here. John lives in Bristol, PA. John is here, has been here 2 years, 3 years. He might be a city resident because we're giving him services. Who's talking to John's family? Because John, in order for John to get the treatment, he's going to need help and support, right? That is still not a policy and a protocol that is seamless. Let us not even speak about getting John into a treatment program, given the fentanyl and the new drugs that are out there. Our treatment providers cannot handle and are not prepared to be able to serve this community. They have not evolved to be able to deal with this community. We're having high-level conversations with doctors who perform major heart surgeries on folks only to see them die 2 weeks later in Kensington because they're unable to tie them right into treatment services and the type of services folks need in the county. So this is very comprehensive. This is ground zero across the country, and all of the departments have been slow to scale up, right, and get those 600 people that don't belong in Kensington connected to their counties and to their families.
Thank you, Councilwoman, for just putting that information on the record. I heard it referenced earlier today, but I just thought that for the benefit of people from Philadelphia who are watching, we needed to get that information on the record today. So thank you so very much. Chair recognizes Councilmember Brooks, and I just want you to know that in queue, we have Brooks, Jones, Bass, and Dom, and then if we have time for a second round, the first person queued up is Gautier. So Councilmember Brooks.
Thank you, Madam Chair. I want a little bit more clarity. The budget received $35 million COVID stimulus dollars over the last 2 budget cycles. Can you briefly list again the new and expanded programs the department funded using these dollars? Because I would like to know the success rate of each of these programs in placing individuals into permanent affordable housing. And I think I heard you say the success rate was 94%.
Yes, so the funds, we can give you a specific breakdown, but I can tell you generally, those funds were able to be used for 3 things: rapid rehousing, shelter, and outreach. I think we tried to use them for prevention. There's too many barriers. So what we did the first year was we backfilled, keeping all of our shelters open. And they have about a 35% success rate in people exiting to permanent housing, which we think is very, very, that's really the shortage of affordable housing. That's why people can't get into more. The rapid rehousing, those programs are in the last 2 years, 81% successful at preventing a return to homelessness. One of the challenges that we faced during COVID was that a lot of the services were being provided through telemed, which is not a good fit for homeless people. So we're working very hard with the service providers now to try and get those numbers back up again. And then we did do some outreach, including our social services encampment resolution team.
And can I add to that, Liz? In addition to that, I know that we were talking about earlier the Class 200 and some of the federal money that came through. As a result of that, so this budget here represents really a budget that maintains a prior pre-pandemic level budget. It does not account for the additional threats or opportunities or gaps that may be facing us, such as eviction moratorium. At that time when we was ready to hit the pandemic, the city was facing significant fiscal challenges. So we had to replace some of the general funds with some of those federal dollars. And so when you're seeing some of the CARES money that are coming in that are due to expire at the end of September, some of that money is really just replacing dollars that were supporting other activities for the city fiscal challenges. There have been success in many other programs Liz has indicated, such as rapid shared housing, and we would love to continue to expand upon those things. But this is a pre-pandemic.
So that's kind of leads to my next question was, because you indicated that these COVID dollars was a one-time source and they'll be ending in September 22 and will not be renewed. Will there be a loss in Will this loss in funding result in the department cutting these programs and services in FY23?
Unfortunately, looking at every program right now, we're very thankful in the proposed budget to continue the SROs that really serve the elderly population. But we're looking at a lot of our programs, especially those sites that we open up for COVID prevention that serve the elderly population. But honestly, we have to look at everything right now. We just don't know what this variance is going to do, how the local economy is going to run, especially as it relates to general funds. But everything is on the table. We're hoping not to and maintain current status.
So, because I'm concerned about the OHS general fund money is only increasing by $12 million, if I'm correct. And I heard you say that we could expand our NPI or ARP contribution to get more units available now to get people off the streets. But I understand you said that the home ARP money will not be able to address the 3,000 or so unit gap that you mentioned.
That's correct. Yeah, so it will, we estimate, Beth, correct me if I'm wrong, somewhere in the neighborhood of 400 units over the life of the program. It'll take some time. And then we are hopeful, and this depends on the outcome of the planning process, that we'll be able to use some of it to replace some of our rapid rehousing programs and provide some of those services. But there's no shelter money, there's no operating money. It's an entirely different set of guidelines than the funds that we got through CARES.
So basically, with this current funding level, we're trying to maintain the same level of homelessness that we're seeing, or are we trying to significantly reduce the number of people who are homeless or housing secure in the city? I'm kind of don't see
I think it will be largely maintenance. The EHV, of course, is helping. That's getting more people into long-term housing, and as we're able to get the NPI out onto the street and the home ARP money, that also helps. I think the unknown is the inflow. And that's what I think Dave was talking about, the impact of inflation, the economy, the loss of economic stimulus, the loss of the federal rental assistance funds. All of those things may have an impact on them, but this is not a growth budget.
Yeah,
I would like to say we're very happy about the budget, but it's not, it's really keeping what we've got and then also helping helping our workers and helping some of the elderly folks.
Because I would like to see new programs and services implemented by the department to address the growing numbers of seniors that are homeless, people with disabilities, LGBTQs living in the shelter system, and I don't see the ability to do that with this budget. But my next question is about the point in time. The count expanded needed for homeless services. Does the city know the outcome of the PIT count that took place in February of this year?
We're still sorting through the data.
Yeah, we're through the data. By the end of April, we'll have our final numbers and we can share that with you.
Because, last year's number, it was 43,000. The traditional number is 57. I'm saying 100.
Yeah. Don't make it worse than it already is.
The traditional number is 5,700. And, I'm concerned that from 2018 to 2020, the PIT count of the people experiencing homelessness in Philadelphia remained virtually unchanged. And in 2021, there's a significant drop to 4,300 people, likely due to pandemic-specific housing programs, an eviction moratorium, and other forms of pandemic aid. But with many of these programs expiring, does this current budget leverage enough ARP dollars to demonstrate our commitment to significantly reducing the number of people who are homeless?
So like I said, we're finalizing for the shelter, the unsheltered now for this year, but we're hoping with the home ARP money, with that we're anticipating an additional 345 units and then an additional 200 with tenant-based rental assistance, which will be a total of 542 units. So we're hoping, based on the count and going through everything, with that additional resource, that'll help with long-term recovery. So it's over a 72-month period that the home ARP funds would assist with. So we're hoping that we'll be able to address some of those needs. But we can't project, like you said, who's coming from the front door and the additional stuff, but looking at our current numbers and looking at the 5-year trend, we're hoping that these resources will help accommodate some of those.
So there's no projection towards the other issues that are currently happening in our city that these numbers could increase and we don't have the capability of providing housing for folks that are in flux right now?
Not exact numbers. We don't have exact numbers.
Oh, Madam Chair, I would like to be teed up for a second round of questions.
Sure. Thank you, Councilmember Brooks. Councilmember Jones, Councilmember Squilla's hand raising function was not working, and he did ask to be queued in and should have been included right after Councilmember Sanchez. Councilmember Squilla, are you still connected?
Yes, I am. Thank you, Madam Chair. I appreciate it, and I'm sorry. I'm glad you called me because I was told to reboot my computer to see if that would help with my chat. But quick questions. One was, I know we talked about the number that Councilmember Brooks just asked about, and the new number I heard that was going to be at the end of April for this year's timing count. So the questions are with Office of Homeless Services, what is the total number that we have just in the Kensington area that are reported or recorded?
About 272 unsheltered.
Unsheltered. So you're saying there's only 272 people in Kensington right now that are unsheltered?
No, those that we know are homeless. As you know, council member, there's a lot of people on the street for other reasons, to buy, sell, and use. Some people come who are housed. Some people get stranded, etc. These are people who we know are homeless.
All right, because I mean that number is confusing to the residents of Kensington, Fair Hill, Harrogate areas, because you see that there's a lot more people that are roaming the streets. But what are we doing differently with the people who are unhoused but on the streets that aren't homeless?
So again,
I think that go ahead, Dan. I was going to say, I think that is really outside of the Office of Homeless Services purview. We're really about homeless services, and maybe I will defer to Deputy Managing Director Eva Gladstein to talk about sort of the broader Kensington strategy. Really, our expertise is working with the people who are literally homeless.
Good morning, everybody. Eva Gladstein, Deputy Managing Director. I wanted to, though, first say, and it's been mentioned earlier, that the Office of Homeless Services does help people connect back to their families who are out of town. I don't have the numbers, but I'm sure somebody else on this call can provide that, and have been referenced also the Department of Behavioral Health and Intellectual Disability Services, which will be testifying later today, also has a family reunification program. But I do think, Councilmember Squill, I think, some of the concerns that we all share is that people are coming into the area who may not be unhoused, but are coming for other purposes. And in that regard, and you and other council members have been great partners in this. We have been working across many city departments, coordinated through our opioid response unit, to try to tackle the many facets of this problem. So the one that Homeless Services is specifically working on has already been explained in terms of the 100-day challenge and the effort to help 350 people over the course of now less than 100 days, because it's launched already, move into housing or treatment services. One other point I'll mention, because I want to give credit to City Council.
Sorry, Eva, I don't like to interrupt, but just to clarify, because I know Liz says Office of Homeless Services does not engage, or it's not in their purview for those folks. So is it DBH that's doing that?
Council member, could you clarify your question then, and maybe that would be helpful? I think Ms. Hirsch's response was, for people who are not homeless, what is OHS doing? Is that your question?
Well, I mean, they're on the streets. So, I mean, whatever you want to call them. Okay. They're on the streets, and they're not in a house. But they have places to go. So I'm just confused on whose job it is to engage them, address that. It sounded like Ms. Hirsch said that that's not under the OHS purview, but it's under a combined purview maybe with DBH.
If I could, and I know Chief of Staff Dave Holloman is trying to speak, so let me do something very brief. There are multiple outreach teams who are engaging individuals on the streets in Kensington. There's an encampment resolution team that is funded and supported by OHS. There are the homeless outreach teams by DBH IDS. As you're familiar with, there's also police-assisted diversion coming out of our Office of Violence Prevention. And there are several other teams as well, including mobile treatment teams coming out of DBH IDS, and wellness teams, CWU, coming out of DBH IDS, and some other teams that I won't bother to mention the names of. So folks are constantly engaging and trying to work with the individuals on the street, either to reunify them with families, if that can be done, to offer and support them into getting into treatment or into housing. But I would like to allow Dave Holloman, because I kind of cut him off, to respond as well.
No, thanks, Eva. And Councilman, I understand where you're going at. Perception sometimes is reality into people's eyes who don't work in this field. What I think, Liz, what we were trying to say is that when we are fully aware of that person and their situation, we do a really good job of getting that person connected to either the housing or treatment services. For Kensington, it's very seasonal. So when someone asks me how many people on the streets of Kensington, I can give you an estimate. I can't give you an exact number because it changes from season to season. What we're able to do based on data is tell you who has a chronicity history based on long-term engagement with various teams. We are working with law enforcement. We're working with DBH. We're working with a multitude of teams down there to really come up with that big picture strategy. I, again, congratulate you, Councilman Dom and Sanchez, for introducing the resolution. You're right. We need more help. We welcome all the help that anyone can provide us on the state and federal level. But Kensington has a multitude of challenges, and we're not saying we're giving up in the fight. We want to be in the fight to try and help reduce the number of people that are out there. So we are trying to work better on how we communicate with the public through a dashboard by getting their feedback, but also doing better assessment of those individuals who are willing to talk and communicate with us along with our partners.
And Dave, I would agree with you on that, and even Liz. My concern is when we give data points and numbers out there, and it is confusing to the community, and it's not clear of how we're dealing with this. And Maria, Councilmember Sanchez touched on this point about how do we, when we touch people, how do we coordinate those efforts to see who's touched by who? And we know there's more than 200 and some people out there on Kensington, in Kensington, Fair Hill, and Harrogate areas. And those people see that. And so when they hear those numbers, that they're the only homeless people, that is it sounds like a big misconception. And that's where we start losing some of the trust of some of our partners in the community.
Thank you, Councilman. I know that is an issue, and we've worked very hard. Community members are very engaged in our work around the 100-day challenge, where we are coming up with as close to a by name list as we can for the individuals who are unhoused in Kensington. And we look very carefully at the weekly street counts that the police department issues as well, because that's the reality for the residents. That those are the people that they see on the street. And so we, but we also know that some of those people are seen routinely by our data, as Dave Howman mentioned, and so they are much more likely to be homeless, where others are coming and going. But I think we agree with you that there's not just a perception, and a reality that there are many more people on the street there, and that's a significant problem that we're all working to address.
Thank you so very much, Eva. Councilmember Squilla, if you are still listening and still connected, again, we apologize for not being able to get you into the queue at the time that you requested.
No problem. I'll come back second round too, Madam Chair. Thank you.
Thank you so much. Duly noted. Councilmember Jones, thank you so much, sir, for your understanding. Greatly appreciate you. Chair recognizes Councilmember Jones.
Thank you, Madam Chair. No problem ever. First of all, a lot of my pre-questions on the budget were answered because of your gracious attendance to come to my office and not belabor the issue, but to inform me about the issue. Since that time, we had a constituent call the office who was homeless. But what struck me about this non-typical homeless person, they work for Amazon. They told me they could afford $1,200 rent, but could not find an apartment. When they went to call Cherry Street about temporary housing for her and her 4 kids, they said because she worked the 6 to 4 a.m. shift for Amazon, there was no accommodation. In today's economy, we have a gig economy, we have different varying hours of work. How are we adapting to the new homeless? And I say that because these are people who are working homeless. They're not your stereotypical homeless, but they fall between the cracks of not being wealthy enough to afford this, but not being poor enough to receive services. How are we adjusting the dials of accommodation for housing based on those factors?
Let me, Councilmember, I'm sorry that they had that experience. Certainly people enter shelter at all hours of the day and night. We are a 24-hour system. But let me turn this over to Roberta Cancelier, our Deputy Director for all of our housing services.
Good afternoon. Happy if the individual or you are willing to reconnect with us. Absolutely want to take a look at what we could do. As Liz indicated, we do offer 24-hour access, and a lot of what we're doing now is doing virtual and remote to assist people who we know have lives and have jobs and other kinds of things. I would love the opportunity to understand more about who that family is so that we can reconnect and assist.
My staffer is probably calling you right now.
Good. Thank you, Councilman.
So, I mean, but I guess the question, the example begs a bigger answer to the question of how are we adapting to what is. I got the fact that you do 24 hours, but they were told, well, what are you going to do with those 4 kids while you're at work? And how do we adjust so that people aren't sleeping in cars like this young lady and her 4 kids are.
Yeah, I think that one of the things, Councilman, that we want to do, and you raise a valid point, as we look at today's economy, society, some of the challenges, we want to have a system that meets the people need. And so one of the things that we don't want to do is cause more traumatic effects by indicating DHS because that person is working. We don't want to penalize human capital. That's great human capital that we want to tap in. We would love to talk with you and many other agencies, with DHS, who was on earlier to see if we can create a pilot program so that person can continue to maintain work while those kids can get adequate child care. Especially, I don't even know what the age they are, but if they're, younger or can't, take care of them, let's assume they're young toddler age kids. We want to be able to put them and set them up in the right process too, so with child care or early intervention, child education, but we don't want to penalize the mom because she's working or the father that's working. So let's be proactive. We're willing to be part of any committee to come up with a pilot program to adapt to the new work environment that we're probably going to stay in forever, to be honest with you. We just don't know what this is going to look like in terms of traditional work hours or, the care that we need for kids.
That's a real responsive answer, and I'm the one I was looking for, because things change. The economy is changing. The face of homelessness changes, and we need to adapt to it. I'm so thankful for my colleagues who have been, dare I say, progressive in their legislation to deal with the crisis well before it hit Philly hard. But as we see what has happened and how we need to continue to adjust to things, I just hope we're as nimble as we should be to accommodate. That lady was talking about quitting her job. And so we don't want that. That's counterproductive. Thank you, Madam Chair.
Thank you, Councilmember Jones. We appreciate that. You just made something else an important priority on the agenda. These are not traditional clients. Not traditional clients, right? But people who are in the workforce, and it requires a different solution. So thank you so much, Councilmember Jones, for getting that on the record. Chair recognizes Councilmember Bass. Is Councilmember Bass still connected?
I am. Thank you very much, Madam Chair.
Sure.
Just a couple of things that I just wanted to mention. One of which is just following up on Councilman Jones's line of questions. And as I was sitting here listening to the situation with the person who was told, we can't help you, it just really struck a chord with me, because I just don't think that at any time the answer should just be that. So I really, would hope that the department would figure out a zero tolerance policy on saying, no, we can't help you. And finding a way that there has always got to be, well, we can't do this, but let me try to do that. Let me try to figure out something for you. And so I really think that particularly with this department, it can't be a no. It just cannot be. The second thing I just wanted to mention was that Councilwoman Sanchez, as we talked about what's happening in Kensington, one of the things that I had mentioned many moons ago is the need for regional work on this issue, that we really have to be and should be reaching out to our friends in the surrounding counties, particularly to find out what are they doing, how can we collaborate, how can we work together. Because when we look at the source of a lot of the homelessness there, which is the opioid crisis, a lot of these folks are from Bucks County, Montgomery County, New Jersey, Delaware County, and so forth. We need to be having regional conversations with these folks so that we can figure out how do we help them access the services that are in their counties that are available to them, that their taxpayers are paying for or tax dollars are paying for. So we want to make sure that they are connected where their home base and source of support is actually located. So those are just a couple of the questions I had. Madam Chair, I'm going to reserve the rest of my questions, which I'll put in writing to the department, and so that way we can get to the second round for those who are in queue.
Thank you so very much, Councilmember Bass. Chair recognizes Councilmember Dom.
Thank you, Madam Chair, and good afternoon. And I want to thank everybody for the work they've done in the past. I'm kind of laser focused on what Councilmember Sanchez, Squilla, and now Councilmember Bass have been talking about, which is Kensington. And it seems to me that the conditions in Kensington today are not really dramatically different than the last year, 2 years, or 5 or 10 years. And it seems to me that we all agree that we need state and federal support to help us here, because it's clear that a lot of these issues are not really Philadelphians. Yet we're asked to pay for them, which is really unfair to the citizens of the city. I think I heard Councilmember Sanchez mention that almost 60% of the people there are not Philadelphians. They may have gotten Philadelphia IDs, but they're not Philadelphians. So I hope we can work together, all of us, in getting the state and federal on board with more support, more money, and having all of the neighborhood people involved as far as what Kensington should look like. I think one of the biggest issues that I see, and I'm going to be, I guess, politely direct, is this a containment policy, or is this a policy to bring back the neighborhood and restore it to what it was? And if it's a containment policy, where we're just going to contain these activities and allow them to continue, that's not acceptable. It's got to be a policy where these 800, not 200, every one of them has to be put into a shelter or a facility that'll help them with whatever illness they have, and we give them all support and help them. And it should be a federal program, because these are, again, not Philadelphians. The majority of them are not. So I just think that we need that cohesiveness of city, state, and federal. When you think about it, this is way worse than a tornado or a hurricane. This has been going on for 20 or 30 years. You know, a tornado comes through, it's an hour. This is beyond any tornado, hurricane, or flood that's occurred in this country. So we need to all work together on this. Having said that, I have a question for you, Liz Hirsch, and I want to thank you and your team. This is a very tough job, what you do, and I understand that. Can you just share with us, though, in the last 12 months, are there any statistics as to how many people in Kensington you've helped put into permanent housing or alternative housing, or just helped get them off the street? Are there any numbers to that area?
So one of the dilemmas, we ask this question of ourselves also. One of the dilemmas about being homeless is you don't have an address or a zip code that we can then do the data matching for. We do support several hundred units of housing, permanent housing, that are dedicated to people who have opioid use disorder or other substance use disorders. And as I said, about 1,500 households did move into long-term housing. But that breakdown from Kensington, no, I don't have that number. The other thing I will say, Council Member, that I think is really important is that providing housing resources in Kensington is a double-edged sword. And so we agree that we need to have housing available for people at every step in the recovery process. But if we were to say that we're going to dedicate housing resources to Kensington, it would immediately become a magnet, and people would flock to Kensington thinking that they're going to get housing. So we don't want to have housing. We don't want to say, oh, you know, these are specific Kensington housing resources. And that's why we target them around people with substance use disorder, chronically homeless, that population, so that it really is, so that we don't make the problem worse.
Right, no question about it. And I come from maybe the position that the 60% who don't come from Philadelphia, we should do whatever we can to help them get back to their homes or their neighborhoods, which are not in Philadelphia, and are all over the country for that matter. I don't see why that should be a Philadelphia issue or a Philadelphia problem. But the 40% that are Philadelphians, or whatever that number is, we should try to do whatever we can to help them. And so my last question for you, Liz, is what has been, in your opinion, or what is needed to be successful not to be a containment policy, but to be a permanent fix for this community?
Well, my opinion is it goes way beyond what the city can do. I think we're doing a lot. I think we're trying to do more every day and learn. But to me, it would take a Marshall Plan. Before the opioid crisis hit, this was a neighborhood that already had a very high poverty level, a high level of infant mortality, of hunger, of unemployment, blighted property. And so to me, this needs a massive investment, not just in the place, but in the people. And not just the people who are unhoused, but the residents there who are struggling day to day with low wage jobs, with deteriorating housing, the young people, that would give them a sense of hope and also help revitalize that commercial district. So that I think this is a neighborhood that should be a top priority.
You know, I'm in agreement with you on the Marshall Plan, and that's why I hope we can get the federal government, the state, with the city, and all the community organizations on board to restore Kensington. So thank you, and we'll look forward to working together. Thank you very much. Thank you, Madam Chair.
Thank you. Okay. Thank you. We are going to start our second round right now, but we're going to have to shorten it to 4 minutes. So in queue, we have Council Members Gautier, Quinones, Sanchez, and Brooks. 4 minutes. Council Member, okay. I see you, Council Member.
Thank you, Madam Chair. Liz, this year, Share Food Program has greatly increased their efforts around home delivery, particularly to meet the needs of seniors and people with disabilities who may not be able to leave their homes safely due to COVID. What support is OHS providing them to bolster these efforts?
I would not feel comfortable calling out individual organizations, if you'll forgive me for that. The funds that go into food access all come from the state and federal government. It's about $6.2 million. And last year, about 10 million pounds came through the Emergency Food Assistance Program. And that those resources, as I said, really are coming from the state and federal, or the federal government through the state.
Okay, I appreciate you not wanting to call out individual organizations, but surely you can acknowledge the importance of these programs in feeding, vulnerable folks in our community. What is the city willing to do to continue, to ensure that these organizations continue to have the resources that they need to operate these critical programs?
Yes, you made a very good point there, Council Member, and I apologize for not acknowledging that. Share is a very important partner to the city and has been for many, many years. And when the founding director did step down and ultimately, unfortunately, her untimely passing, the new folks have come in and really tried to modernize. And Philadelphia is also fortunate because we also have Philabundance, another very large, high-capacity food distributor. So we work very closely with them and with the state to try and maximize resources. One of the things that I think is really important to know as we're talking about state and federal policy is that all of the food access programs, they're not really about the people who need the food. They're really about the farmers and the food producers offloading extra food. And so it's not unusual for example, Share Philabundance to get truckloads of, let's say, garbanzo beans. And so one of the things that Share and Philabundance bring to the table is they find ways to augment that food so that people can get food that is conveniently located, that's culturally appropriate, and that's nutritious. And boy, oh boy, I don't know what we would do without them.
Yeah, and I would just add to that, Councilwoman, that there's a number of different organizations that don't get the recognition, like faith-based institutions that provide meals to individuals who are in need and families that are in need. So we're continuing to work with all of those organizations. to make sure that any grant opportunity, funding opportunity, that we're there to support them, whether it's through a letter of support or helping them provide technical assistance. But I just want to, point out that Philadelphia have a lot of needs. We saw that during the pandemic where food insecurity really came up. And I would give credit to all of the organizations and faith-based institutions that are doing that work in that space.
Thank you. Lastly, LGBTQ young adults comprise one of the fastest growing segments of our homeless population. Is there anything in our city's budget specifically set aside for the needs of homeless young adults who identify as LGBTQ+?
Yeah, so this is a tricky one. We don't do carve-outs by population. What we try to do is focus on access and marketing services and trusted messengers. So, for example, we fund a program that works through William Way, where LGBTQ youth may go and get the services to them there, or the Attic, or Valley Youth House, or our youth access point. So what we try to do is work with that network of providers who who those young people trust, and then bring the resources to them in those locations.
Thank you so much. Thank you, Madam Chair.
Thank you, Councilmember Gaultier. Chair recognizes Councilmember Sanchez.
Thank you, Madam Chair. As part of your presentation, and I really appreciate the one pager on your fiscal year and the services provided, could you adapt that and put a cost per service on those models? Again, we've had this conversation before around us not moving around the very expensive transitional housing. Can you speak to me about what, if any, changes are going to happen with transitional housing?
I thought you'd never ask. I was waiting for for this question. So we have shrunk our transitional housing programs by about, let's see, I think it's about 800 units over the last several years. And the only ones that are left really are the ones that are site-based in buildings that it would cause it would cause an empty building, and we're working with some of those providers to actually transform those programs into permanent housing. And we're working very aggressively on that because housing really is the answer. And I would be happy to provide those numbers for you, Council Member.
So how is that money being redirected in terms of some of the other models that are more successful and more efficient?
Yeah, we are redirecting it into permanent supportive housing and rapid rehousing.
As it relates, and I know you said you guys are doing your survey, as you know, I put forth a resolution. I really believe that you should come before council about what you're going to do with those $40 million before you invest them. And I really want to see them tied into the housing action plan. So, as much as I appreciate all that feedback stuff, if necessary, we have a resolution so that we can have a hearing and a conversation about that, because I think that's hugely important.
We agree, and actually, it does require a substantial amendment to the consolidated plan, so it will come before council.
Okay, Eva, if you're still on, I'd like to ask you what I asked Liz. We did a survey of all of our partners in Kensington, and everyone is bracing for a worse summer. Could you speak to what, if anything, we're going to be doing different to avoid the horrific summers that we've had?
Yes, I'm here. Thank you, Councilwoman. We've talked about some of the things that we're doing already, including the 100-day challenge. I know that when Jessica Shapiro from OCF was on, she talked about some of the work that we're doing with other agencies, part of the Office of Children and Families, and our cooperation with the police department. I did want to say earlier a thank you to council members, including yourself, first and foremost, because the mayor's proposed budget does have funding for the fines and fees that would enable what people commonly call the drug court to restart, which we think has been months in the work, and would be another important tool that we would have more on the in terms of carrot and sticks on the stick side. So I'm not sure what the steps are to get that open again, but one of those preconditions for that is in place in the proposed budget. So I wanted to reference that also as being something that is different. And also there'll be other public safety and violence intervention programs that will be initiated in the East District as well. I'm not quite sure because that's not in my cluster, but the timing of all of that. So we are looking at this.
What, if anything, you can speak to what policy conversations have you had around the treatment services piece of it, right? Drug court, which, you know, it's been frustrating that it's taken us this long, but there's a carrot and a stick. What are we going to be doing differently given the type of drugs that are in the street to get people into treatment?
Yeah. Well, I'm sure you're referring to Tranq, what's commonly known as Tranq, which is an animal sedative. Right. We've had conversations with both public health and Department of Behavioral Health and Intellectual Disability Services on this. It's very difficult if you read the and I would encourage you to, speak to them when they're here this afternoon. It's a very difficult question because Narcan can be used to assist those individuals, but it evidently is a very painful, difficult withdrawal, and the other kinds of medication-assisted treatment that's available for opioids and fentanyl is not available here. So it's something the medical community, my understanding, is still struggling with, very unfortunately.
Councilmember Sanchez and Eva, because we've got to get prepared for the afternoon, we're going to ask you, if you will, to just stick around and come back if we need you a little later. We have one more question that will finish up this round, and upon Councilmember Brooks' finishing her questions, I will let members know what time we will reconvene this afternoon. Councilmember Brooks, are you? Oh, I see you. Okay.
Yep, I'm here. Thank you, Madam Chair. I just need a clarifying question from Councilmember Gautier. Liz, did you say that no funding will be changed with the folks who receive with the food pantries? There will be no change in funding to those folks?
I said that the funding comes from the state. It's federal money that goes to the state, and then we really are a pass-through, and then it goes to the food distributors.
So the money that we're passing through, will that rate changed to any of the food providers?
The amount of money we're getting from the state, I don't know. They have not informed us if there's going to be changes yet about any of that.
Okay. So my last questions around homeless prevention assistance that Councilmember Gautier mentioned earlier as well. I'm concerned that the target numbers of the individuals to be receiving homeless prevention assistance is going down. What was the method of reaching these targets? So what we have is 1,873 in 2021, 1,400 in 22, and 1,400 in 23. And these numbers came from the OHS budget testimony. And I was wondering, has this budget incorporated the current and ongoing rise that we're seeing in PHA evictions and the limited availability to the rental assistance compared to applicants, and also the rental assistance altogether?
Yeah, so that's a very good question. We promise, we set our goals a little bit low and then try to exceed them. So as you noted, those goals have been lower, but we vastly exceeded them every year. So we're very good at rubbing the green off the dollar. We do not think that we will be able to fill the gap left by the loss of the federal rental assistance funding. Was simply not possible with the dollars that we have. But we will deploy any dollars that come our way as efficiently and effectively as possible, and try to get those numbers up with anything that we have that's made available to us.
Okay, well, I hope that we'll be able to partner so we can see or figure out how to get more funding, because my office has experienced an increasing number of calls from PHA residents that are being evicted. And my fear is that, if we don't plan for it, it's going to increase the homeless population, and we're talking about families. So I definitely want to continue to be in this conversation.
Yes, we would be very happy, and we have worked very closely with PHA in the past, and they've been very flexible around their eviction policies. So I do believe that that will be a promising conversation to have. So we would love to work with you on that.
Definitely. And I want to go back to the crisis that took place in shelters during the Omicron surge in December and January, because it's relevant given COVID news this week. So can you please describe the conditions that caused the COVID outbreaks in our shelters this winter, and some of the takeaways and lessons learned that will be implemented in the shelter for future outbreaks?
Yeah, very good question. Well, I mean, I think that the shelter system and the homeless system in general was no different than every place else in the world. Everybody was completely overwhelmed. It was a tidal wave. We had a tremendous number of staff who were calling out. Even if they weren't having symptoms, if they were testing positive, they had to stay home for their own family's safety. So we had that perfect storm of 27 out of 31 code blue days in January, staffing shortages caused by Omicron, and then many of our people also contracting Omicron. And I don't think there was a system anywhere in the U.S. that was really of any sort. The employment system, the police force, it doesn't matter. Everybody was hit hard by it. We had never experienced anything like it. So we've done two things. One is we now have a COVID recovery isolation space open that does have 40 beds. We've had our second person get admitted yesterday who is positive, and this is a person who doesn't require hospitalization. And we have now convened, starting next week, a health preparedness group that's going to be led by the Office of Emergency Management. It's going to be led by homeless service providers and people with lived experience, with the support of staff from OHS, DBH, IDS, and the Public Health Department to try, and the goal is to come up with plans for the next infectious disease outbreak. But as you know, Council Member, and as everyone knows, really the solution is for people not to be living in shelter. Anytime we have people in congregate shelter, they are more vulnerable to any kind of infectious disease. It's not ideal. The real solution is for everybody to have a place of their own to live in.
So is this plan to
Councilmember Brooks, I apologize for having to interrupt here, but we have to finish this session because it was supposed to be a half an hour, but now there's 29 minutes that we're going to have to grab a cracker and some water, because we're going to have to be back here at 2 p.m. To reconvene for this afternoon's hearing, where we're going to hear from DBH along with Public Health. So I'm just going to ask Council Member any other additional questions, if we can forward them over to OHS and/or have them addressed when we have our callbacks, so that we can thank you. So our stenographer, we thank you so very much for being patient with us. You haven't had a break. For the record, let me just note that this committee will stand in recess until 2 p.m. today. And when we come back, we will hear from the Department of Behavioral Health along with Public Health. Thank you all so very much for your patience. Thank you, Council President. See you at 2, everyone.